Good afternoon, everyone. We will soon begin the session. Just waiting for a few more to join in. So, a warm good afternoon to one and all present here. So, we will start the session now. I think we all are looking forward to the musing, and I see some newly joined participants in our musing. So, just giving you all a brief idea of what musing is and how it all began. So Dr. Preeti Shah and Dr. Prajakta Vaidya are the founders of Healing Harmony Homeopathic Clinic and Homeopathy Musings, which is an online platform for homeopaths all around the world to participate and learn in sessions. So it all started when COVID began and we couldn't go out to learn. We couldn't venture out, and this was something that was founded by the two dynamic doctors, and it became a huge success. And we have a very dedicated group of participants who join every month for our musings, who participate in our courses and modules that we conduct on a regular basis. So I welcome you all in our homeopathic musing sessions for today. So we have our ongoing module. If you didn't know already, we have a plant module that is ongoing. It is a one-year module in the whole of 2023, beginning from January to December. The key speakers are Drs. Preeti Shah, Prajakta Vaidya, and Reni Shah. And the chief mentor for this module is none other than Dr. Mahesh Gandhi, sir. So we have already kick-started the module and it's going good so far. There are still registrations coming up. So we can give the recordings for those newly registering participants. The recordings will be available till the end of next year. That is typically starting from now on. So till the end of 2024, you will have all the recordings of the plant module. So we will be covering all the subclasses and families in the plant kingdom, which is otherwise so vast. And for those who cannot commit for a year of plant module, we have decided to open up the a la carte plants. And this is an opportunity for those of you who have not yet registered and would like to learn just a group of the plant kingdom, say a subclass or 2 or 3 subclasses together. This is the right opportunity for you. The details are flashed on the screen. In case you have any queries, you can contact me or Asmita. So you can invest in whatever you like, whatever you choose. So it is a platter for you to choose from. And today's topic is anxiety for the family physician. I think this is the topic for the day, for the world today. Everyone has anxiety, isn't it? We've heard children talking about anxiety nowadays. So anxiety is actually quite misused nowadays, but we need to know as family physicians what is anxiety and how to dissect it, how to decode it. And here we have Dr. Vidya Arunachalam, who is with us here today. We welcome you, ma'am. Thank you for accepting our invitation on Homeopathy Musing. A little about Dr. Vidya. So she is a MD homeopath, specialized in practice of medicine. She is an homeopathic consultant and a positive psychology coach. She was a former assistant professor in the prestigious C.M.P. Medical College, the Department of Materia Medica. And it is an honor for me today because she was my teacher, and I have to admit I was her fan in college. The way she dissects the Materia Medica, the remedies, giving two aspects of one remedy, that is, one is a psychological aspect and one is a clinical aspect. I think not just me, but the entire college was a big fan of her teaching. So I'm really happy to have you here, ma'am. She has a private practice in Homeo Nexus in Juhu, Mumbai. So she's been an active speaker at various webinars covering various topics like mental health, APD, headache, psoriasis, etc. Right from her younger years, she has taken a keen interest in people and the way they live. Her background in homeopathy has given her a unique blend of practical, clinical knowledge and the workings of human psychology, which has allowed her to delve deeper into understanding the genesis of pathos. So like I said, both on psychological aspects and clinical knowledge as well, while practicing or while seeing a patient. So she does have interest in psychology and pathology. And having studied and graduated, done her MD from ML Dhavle College, she's worked with a large diversity of the human populace in places like the hardworking but quiet villages of Maharashtra, to the chaotic and energetic city like Mumbai. So she's had the experience of both the energies in rural as well as urban cities, and first-hand experience in the tremendous potential that homeopathy has in restoring health. She hopes of not just eradicating an illness, but also work towards building an internal environment that will allow a person to thrive. Along with her practice, she is also a passionate advocate of positive mental health, and she believes the mind and body is the way to live and enhance satisfying life. So we welcome you, Dr. Vidya ma'am, on Homeopathy Musing. Thank you for being here with us. Just before we begin our session, I'd like to address a few basic hygiene factors. Kindly mute your lines all the while. You may keep your videos on. It will help in interaction and avoid the temptation to multitask as we all usually do. You may either raise your hand if you have a question, or you can put it up on the chat box, which will be addressed towards the end of the session. Kindly refrain from scribbling on the screen. The most important thing for every session is to enjoy the session, share your experiences, and carry it forward to your circle. We have our videos on the repertoire of learning. The links for our YouTube channel and repertoire are flashed on the screen. You can use any of the videos that we've had in the past. And lastly, if you have any questions or difficulties, you can either contact Asmita, who is musing coordinator, or myself, Dr. Twinta, for any queries regarding musing or any other queries as well. Thank you for your patient listening, and over to you, ma'am.
All right, thank you so much, Twinta. That was a very nice introduction. I'm feeling a little overwhelmed listening to my student talking to me. Very nice. Thank you so much. All right, so today we're going to talk about anxiety, and I would like very much to speak of anxiety from a perspective of a symptom as opposed to a diagnosis. Okay, I understand that in psychiatry there are various ways of looking at anxiety, classifying them as disorders, classifying people's personalities into a categorization, like what kind of personalities they have and how they function. But let's be very honest, all of us are family physicians, all right? We are general practitioners more often than not, and it can become a little overwhelming. But at the same time, when we take their case histories, when we talk to them, when we open their life out and dissect them, we make our patients go through it as well, right? So understanding anxiety as a symptom in its totality is very, very important, because one is you must understand how it produces changes in the person's personality, it brings about illnesses in the personality, makes it stay, right? It becomes a maintaining factor very often in cases. And how it also then becomes difficult for us to, no matter how well selected our remedies, we are not able to really guide the patient out of their practices, or we are not able to guide them from their mindset, right? And that is why many times we see recurrence occurring in our diseases, right? The patient feels better for a while, then they fall sick again, because we have not really understood in totality how the mental maintaining factor is contributing to the illness. All right. And also, of course, understanding our materia medica, which is so vast. Now, if you look at the rubric of anxiety, just anxiety in your repertories, there are close to, I think, 500 remedies or so. And that list is just going to keep continuing as people practice and as you bring more remedies into homeopathy. So obviously, it's not going to be an easy thing to just select. If you say, okay, I'm feeling anxious, you are not going to be able to classify the patient, or you're not going to be able to come down to a remedy. All right. All right. I'm sorry. Is there any? 1 second. Can you just? I'm getting this thing about the audio. I'm going to take off my Bluetooth headset and see.
Sure.
Better now? Are you all able to hear more clearly?
Yes, yes.
Yeah, because I think so.
It's better, really. It was disturbed. Thank you very much.
Yeah. All right. Yeah, so we were speaking about the fact of understanding anxiety in its totality. All right. Now, I do have a section, very small section, that talks about anxiety disorders, but we are going to take that after the presentation is over, if we have time and if people are interested. But otherwise, I would like to concentrate more on the case taking, understanding of the symptom, how it develops in a patient, and what we are going to do when we get information about it, and how we can bring it on to materia medica and select a remedy. Okay, so that is going to be the format, or that is going to be the flow of the presentation that I am taking. All right, I will just share my screen. All right. Yes, I think she's already given me an introduction better than I could myself. So, right. So today what we're going to do is go through the basic understanding of anxiety, what it is and how it expresses itself, both from the perspective of the mind as well as the body. And we're going to see what it does to our physiology. Okay. Now, you must understand one thing: when we speak of the mind and body separately, that is for our convenience. We are not doing this because they are actually separate. All right, we get very easily distracted when we speak about symptoms, that, okay, your mind is a separate entity on its own and the body is separate. That is not the case. They feed into each other continuously, and you will see through the course of the presentation how like the mind plays into the physical health of the patient, and how the physical health then makes the mind worse. Okay, so that is a constant cycle that is there, and that is something that is very important for us to remember when we are treating patients, especially if we want to cure them, not just make them feel better temporarily. The importance of case taking and identifying anxiety and its underlying cause. Of course, an approach to a patient who is suffering from anxiety. Utility of repertory and a totality formation, and therapeutic understanding of cases of anxiety. Okay. Now, anxiety very often just correlates. People just use the word stress very loosely, and then they talk about anxiety. Okay, so how it plays a role in contributing and starting an illness in the body, and how it maintains it through and through. Okay, and what is our scope in alleviating this distress? It is very important for us to understand that, because you don't want to raise the bar too high right at the beginning. You need to make a structured therapeutic plan for the patient, and then guide them through it, saying that, okay, this is what you can expect first, and then you will see the coming improvement. Okay, and better understanding of the constitution or chronic remedies in materia medica, and how to use acute or specific remedies. So first, we're going to talk about anxiety in general. Okay, so it is defined as a sensation of apprehension, tension, uneasiness that stems from anticipation of danger, which might be internal or external. Okay, now this is the official definition. What I will say through my years of practice is that anxiety needn't be caused just because you have something that you consider danger. Okay, Anxiety many times can also occur when you think that the desire that you have is not going to be fulfilled. Okay, so for example, you might feel anxious if you are anticipating being shouted at by your boss. Okay, so that is one way. So that is an actual danger that somebody is going to insult you, somebody is going to shout at you. The second thing is also anxiety that comes from not receiving a text message from somebody very special to you. So there is no danger in that. But at the same time, your desire that you have is not being fulfilled. It causes a level of frustration, and many times people develop a sense of anticipation and anxiety. Okay, so this is something you have to know. Of course, there is a difference as far as intensity is concerned. So some anxieties might be very minor, and some anxieties might be very, very high and intense. Okay, anxiety is a more generalized feeling. Okay, there is a sense of very unease, there's a lot of worry, and there is a fear that is not necessarily tied to a specific threat or danger. So usually it is a very broad spectrum thing. So like for example, if I have anxiety while traveling, okay, so that anxiety can be right from not having a proper vehicle to travel in. You know, it can be a rugged vehicle, the roads can be very terrible. You may not get food on the way, you may not get bathrooms on the way, right up to the fact that you might anticipate getting into an accident. Okay, so they've got a varied sense. So anxiety about traveling can have a very broad spectrum understanding, whereas fears or phobias, which we will come to next, is a very specific thing. So you have a fear of ghosts, or you have a fear of the dark, you know, something very specific that triggers that feeling. It is characterized by excessive and persistent worrying. Now, worrying is something that we have to understand. We again very usually use the term of worry and anxiety together. But what usually happens, the way the things cascade, is that first is you have one thought that comes in, a doubt that comes in. Will I be okay? Will something happen to me? And what that doubt does is it starts to make a lot of scenarios. Okay, so supposing example, taking that thing of traveling. Supposing I'm going to travel from destination A to B, your brain will start coming up with scenarios. What if there's a tire puncture? What if we run out of water? What if we get stuck somewhere in the dark? And what your brain also starts doing is automatically starts to try and solve that problem one after the other. Okay, so if the tire gets punctured, then we can do this. If we run out of water, maybe I should carry a few extra bottles. So worrying is this consistent cycle of identifying a problem and coming up with a solution without actually acting. Okay, and especially in situations where you have no power, like somebody texting you or your boss shouting at you, you don't have any power in that. It is according to the other person, right? What they decide. In such situations, this scenario replays again and again and again and again, and it becomes very frustrating. Okay, so anxiety is the thought, or it is the feeling that you get after you have the thought, and then it can lead to a lot of worrying. Now we were just speaking about the fact that fear and anxiety are not very different. Okay, they're not very far apart. But fear, first of all, tends to be more acute. It tends to be more specific, and it tends to be far more intense. Okay, so when you say I'm frightened, it is a very, very strong emotion, whereas anxiety might be a little bit more mellow. It might be more long-standing. And usually a person cannot withstand fear for too long. COVID was an excellent example for all of these things, like both anxiety and fear. You saw that everybody used to wear the mask, right? But then after a point, no matter how dangerous the illness was, no matter how much people were saying that, you know, the strain is very, very dangerous, you could go into the hospital, you can lose your life, people stopped wearing the mask. Because after a point, fear just cannot pertain. A person will just overcome the fear and decide that, no, I cannot handle this for too long. I will have to I will start doing what I feel like doing. And the reason I'm saying this is because fear very often is used as an emotion to get people to do things. Especially if my students remember, then in the class, many times when I would shout at them, they will only listen to me the first 2 or 3 times. Then the 4th time onwards, they'll say, okay, we are not really bothered if she yells at us, it's all right. Okay. So fear arises with the threat of harm, either physical, emotional, or psychological. It can be real or it can be imagined. All right. And this is where you're talking about the same feeling, but at different intensities. So you have trepidation, nervousness, anxiety, and then after that, the really high intensity feeling starts. So you have a feeling of dread, desperation, panic, and horror. Now, the reason anxiety and fear are worse emotions than the violent ones, like anger or irritation or all of those kind of things, the reason it is more dangerous is because in anxiety and in fear, you are giving the power away completely. Okay. In anger, you are still retaining a certain amount of your power, saying that, okay, I can fight back or I can shout at the person. I can do something in this situation. But in anxiety and fear, what happens is that you have completely given away your power to the circumstance and you feel extremely helpless and you feel very, vulnerable. And that is why this is such a exhausting emotion. And that is why people are more afraid of feeling fearful, feeling anxious, than they are afraid of feeling angry. Okay. Okay, so we're going to analyze the symptom of anxiety. First is how it starts and how people get caught into the loop of anxiety. Okay, so the first thing is that when a person gets this doubt, like I told you earlier on, they will have something that enters their brain. Okay, and then they will start scanning their entire environment for any kind of danger. Okay, so for example, if a child is caught in a situation where the parents are very emotional, they tend to be very aggressive, or they themselves are very anxious patients, what the child starts to do is starts to tick off. Okay, if I dress like this, then my mom might say something. If I sit like this, then my mom might say something. They start to become very, very worried, and they will start scanning the entire environment for what are the things that can go possibly wrong. And obviously, as you can identify more and more things that can go wrong, you start to panic more and more. Okay, so increase scanning for danger. Okay, along with this, physical symptoms will start intensifying. So if you have palpitations, then they start to grow. If you tend to perspire, it will increase. Trembling can happen. All right, and the attention narrows and shifts to the self. So at that time, you will see a lot of people who are very harrowed. They can be very hasty. They can be very, they bump into things. They can drop things very easily. There's a lot of awkwardness that comes up because their attention has gone from the outside into the inside because they're so preoccupied by their troubles. They will try and escape or avoid the situation as much as is possible. Okay, so a lot of people, for example, with social anxiety, will avoid going out to meet their friends. They will avoid going out to new places. A lot of people will stick to the tried and tested methods as much as is possible. Okay, there is short-term relief that can occur either because they take action or they will avoid the situation as much as is possible. But if you do not resolve these issues inside, you do not fix them inside, what will start happening is this will start building up and becoming a very big problem. Okay, so long term, there is an increase in physical symptoms of anxiety. There will be more worry. There is a loss of confidence about being able to cope. All right, and increased use of safety behavior. So for example, I'll give you something very simple is crossing the road. If a person is worried about crossing the road, they're afraid of traffic, what they will do is they'll hold on to somebody's hand or they will ask the person who's driving them to drop them exactly at their location. So it will give you short-term relief. All right. So for at the time being, you'll feel fine. But in the long term, if they keep repeating these behaviors again and again and avoid crossing the road, when they finally do have to do it, it will become a huge task for them. It will become a mountain. They won't be able to surpass it. And the second thing is they will also start becoming dysfunctional. So they will start to avoid areas where they have to cross the road. They will start changing their schedule. They will start to panic if, for example, an auto rickshaw fellow doesn't drop you at the spot and drops you on the opposite side of the road, they'll start panicking. Okay, so you start to see functionality reducing at the mental as well as the physical plane. So when you are taking the history as much as is possible, you will try to take it in this format. First is the event that caused this. All right, an event. Now, please understand, like I told you before, anxiety can occur when you do not get what you want. So the event can in fact be something that produces a lot of anger in you. Okay, so you might have ailments from indignation, you might have ailments from vexation, or you might have ailments from disappointment in love. You may not necessarily always get anxiety, anticipatory anxiety, anything of that sort. It may not be anxiety related. It can be something that causes a break in their momentum of life and they don't get their desire. So the event that caused it, the feeling that the patient had, now this is something that you really must pay attention to, because we have a habit, or at least I used to have a habit of just automatically placing myself in their situation and assuming, okay, that of course if they were humiliated, then this is how they would feel. You must ask the patient how they felt. Now, this has a dual action. One is it is going to give us a lot of clarity. We are going to understand which remedy to pick up, what symptom the patient is undergoing. The second thing you must understand is that while the patient is talking, it is going to make that situation far more coherent to them, and they are going to understand what happened. So many times our case taking itself can produce a certain amount of resolution in the patient. All right. They come to terms with what they have undergone. So speaking is a very, very powerful tool. So please make sure that you try to guide the patient while this particular situation is occurring, that while you're taking their life history, guide them to really get in touch with their feelings and speak out. It may not happen in the first attempt, okay, especially when you're just building the rapport, you may not get full clarity and full disclosure, but as you build a rapport with the patient, you have to keep retouching it slowly and ask them to really get in touch with their feelings, okay? Now, once this patient feels something, they will behave in a particular manner, and they are not the same thing. Okay, so the person might feel anxious, but they might also react very strongly. So, for example, in anacardium, in homeopathy, the remedy, they have extreme fear and anxiety, but they react in a very violent and aggressive manner. And when you look at a person who's behaving aggressive, you wouldn't necessarily think that it is stemming from so much of fear. Okay, so please make sure that you make that differentiation between feeling and reaction and behaviors. Along with this, ask them if they have suffered from anything during that episode of anxiety or during that event, like palpitations, a feeling of pressure on the chest, or feeling like everything has just stopped, shock, or any kind of physical symptom that has ensued from that event. So since that time, they found themselves to be very wary, they have found themselves to be very fragile. Okay, so ask that also, that from at the point and from that point onwards, whether that event has had any physical effect on them. Okay. And the last is dreams. Now, this is very important. All right. You don't necessarily have to decipher the dream. Okay. You don't need to know that if the patient saw a bull, or if they saw a tiger, or if they saw a snake, that it has a very significant meaning. You don't have to go through that. But what the dreams are, is he surrounded by danger? Is he constantly running away from something? That will give you a sense of what the patient is feeling inside, the turmoil that they're feeling inside. Many times when the patient feels trapped, they will have a dream of being on an island surrounded by water. Okay. Or if they are feeling constantly on the run from something, that they're trying to avoid a situation, they will feel like there are wild animals running behind them and they are being pursued. Okay, so the dream, the quality of the dream is something that can really indicate what the patient is feeling inside. Okay, and also ask them how they felt during the dream. There are a lot of people who will feel very vulnerable, they feel threatened in the dream. And as resolution starts to occur, you will start to see that they might have the same dream, but they will feel very contented and very confident with it. Okay. Also, when you are looking at anxiety, you have to look at it from two perspectives. One is causation. Like I told you, it may not necessarily have anything to do with anxiety. It can be any emotion that is there, any situation can cause it. Okay. The second is the maintaining cause. Now, once the person has been triggered, there might be something that troubles them further. So, for example, the wife might be very upset with the husband that he might be the causative factor, but the baby or the child becomes the maintaining cause because she does not have enough vent and she hasn't resolved the problem. So something in her environment is giving her more stress. And third is the behavior of the patient. What is it that the anxiety causes them to do? Okay. So that is where we will go a little further. I will speak about this when I'm speaking of the miasms and the presentations that are there. But the behavior is also very essential and it will indicate a lot of how the patient is learning to cope with the situation. So when you are speaking about anxiety, the first and foremost, what a patient feels tends to be anticipatory anxiety. Does anybody know what anticipation is? Can anybody answer that?
You can unmute yourself and answer.
Or type it out if you feel like that there's no pressure.
Something that you expect.
Correct. Okay, so you're constantly thinking that something is going to happen. Okay, so if you've eaten a chocolate that your mom told you not to have, so you're constantly going to wonder, is she going to find out? Is she going to hit me? Is she going to shout at me? Don't hit your children, but then see, think of it from that perspective. So something that you are anticipating going to happen. And anticipatory anxiety is something we all struggle with. Okay, all of us have it. If this continues and this doesn't get resolved, people do not have any. I'm sorry, I think there are a couple of chat
Yes,
assumptions of
Dr. Sonali.
future and something bad that is going to happen. That's true. Okay. If anticipation doesn't resolve itself, it can shift into two areas. One is agitational anxiety. Okay. So, what agitational anxiety is that since your brain is coming up with scenario after scenario after scenario of something bad going to happen, what happens is your body starts revving itself up to solve all of these problems. Okay, it is going to put in bursts of energy. It is going to make you very active. That okay, if something happens, if some danger is going to come through, you're going to get up and resolve it. So people will start finding themselves being more restless. They're going to start finding themselves to be more nervous. Okay, you will have physical symptoms like trembling. You will start having symptoms of palpitation. The patient will all constantly look like they are on their edge of the seat. Okay, like they're just going to get up and do something. Physical behavioral traits that you will see is the patient starts to become hasty. They drop things. They become clumsy. They'll start to stammer sometimes because they are already on the brain has already reached the fifth word, whereas the first word is just starting to come out of the mouth. Okay, so you will start to see that the body becomes really revved up and very, very irritable, right? The nerves are on the edge. The second way is depressive anxiety. Now, this is the other end of the spectrum. The patient will say, what is the use? It doesn't look like my problem is going to be solved. Okay, I seem to have a lost cause in front of me and I just cannot get out of the situation. So the patient will start having very dark thoughts, very low, very, he starts to really go down. Okay, so even when you're looking at it miasmatically, you will start to see that the sodic and tubercular miasm tends to go towards agitational anxiety, and psychosis and syphilis starts to come towards depressive anxiety. It's basically like your body starts shutting down or your mind starts shutting down slowly. That there's no use. What I'm going through doesn't seem to be ending at all. And I think I'm only unlucky. People start to say, I'm only unlucky. There's nothing that I can do. Okay. So they start giving into the situation and losing hope. Okay. So these are the two broad spectrum categorizations of anxiety that you will see in your patient. Of course, a person can shift between agitational and depressive, but more often than not, depending on their personalities, they tend to stick to one category. Okay, now talking about the symptom, you will see that anxiety is a feeling all of us have. Okay, anytime something happens that is unexpected, something that can be threatening, that can be dangerous, all of us have it. Whenever we do something for the first time, when we are approaching a new situation in our life, everyone will have a little bit of anxiety. So that is a momentary feeling, lasts a short span of time. If a person is resolved, they have a good self concept, they have good coping mechanisms in place, the anxiety will come and go. They will also be very self aware and they will be able to analyze, okay, this situation is causing this feeling. Let me sit back and see what I can do. Can I do something outside of me that can change it? Can I change a circumstance, or should I change something within myself so that I can tide by this time and let it go? Okay, so feeling is a healthy thing. Everybody goes through it. It's an expected response. Now, something you must understand is all feelings exist as a defense mechanism. Okay, if you are feeling anxious, if you are feeling threatened, if you are feeling angry, that is an indicator. Like just like if you bend your wrist in the wrong way, it will pain because it's not supposed to happen. It's not healthy for your body. All right. So in the same way, if you're doing something mentally that is not correct for you or that is troubling you in any way, your mind is going to give you an indicator. That is what feelings are. All right. So you must understand that discomfort is not the problem. The way you handle the discomfort is what you are looking out for, how to be healthy in that manner. Okay. But if a person is unresolved and they have this feeling, it really affects them. Like I say, when people feel disempowered, that they are they are vulnerable towards their circumstance. They do not have any power in their lives. They will start allowing it to affect them for a long period of time. They will start to brood and they will become miserable, they become sad. And that is when you say, I'm having a mood. It lasts for a long period of time. It can last for a few hours to a few days. Okay. If this mood is not resolved, slowly, it will start trickling into becoming a state. Now, this is what you call as an acute or a phasic thing in homeopathy. Okay, so physically it is much easier to understand. So for example, if you have a fever, what happens is during the fever, that fever takes precedence. You do not have access to any of the other symptoms because your body is preoccupied with this particular state. So at that time, you will not have access to the patient's hobbies. You will not have access to their patient's thinking processes. You will not have access to his other, may not have access to his other physical symptoms also, because the fever is so overwhelming. Okay, so this can happen at the level of the mind also in any feeling. So anger can be something that can create a state. Boredom can be something that creates a state. Okay, so what happens in the state is that that particular feeling or that particular complaint takes precedence and basically eradicates or pushes everything else to the side, and you will not have access to these things. Okay, so many times when we talk about anti-miasmatics also, we speak of breaking that state, right? So that the original picture can come out. So what happens is that patient just gets so preoccupied with their anxiety that you just don't have any other thing that shows up. So even while case taking, when you speak to them, they will repeat the same thing again and again. Even if you try to divert it, saying that, okay, I understood about your anxiety, let's talk about your hobbies, they might say one sentence and then they'll come back and loop back. But doctor, since I'm anxious, this is not happening. Since everything comes back to that same spot. Okay, so that is known as a state. Now, usually when you are a child and you tend to have these states every now and then, people will start commenting about it. Okay, so if you were anxious before your first recital in school, or you were anxious before your first exam, people will start talking about it. Oh, you seem to be a very anxious person. Oh, you seem to have these traits in you. Oh, you seem to be very irritable. You will also start noticing, yeah, every time I have this incident that occurs, this is how I react. These are the feelings I have. So then you will slowly start imbibing it, and you will start making it a part of your character. Okay, and that is when it becomes an attribute. An attribute is a chunk or a section of your personality. It is your nature. Okay, and that is how people will talk about themselves. So you, as a homeopath, if you ask, why don't you describe yourself to me? I'm a very anxious person. Okay, or I'm a very irritable person. That is how you speak. So that is how you identify yourself. Okay, so I am an anxious person. That means whenever I am whenever I face any situation, the first reaction I'm going to give out is anxiety. You have primed yourself to it. Okay. And when that continues and it becomes a solid section of your life, every aspect of it, of your life, is dictated by this attribute. Okay. That your traveling is dictated by it, your relationships are dictated by it, your work ethic is dictated by it. It starts to become solidified into a personality. Okay. Understood so far how it goes from being just a simple feeling to a personality issue. Okay. Of course, you have circumstances that contribute to it, social strata that contributes to it, people's opinions that contribute to it. Okay, everything. And once your functionality starts to reduce, as in you are not able to socialize anymore, you are not able to work properly anymore, it starts to create havoc on your system. You start to fall sick very often. Then you will start to categorize it as a disorder. You are not able to maintain order in your life because of this particular situation. That is why it starts to become a disorder. Now, when this happens, when you start to see people becoming disorderly or they start to dysfunction, it is very important. If you are not already into psychiatry / psychology, please refer the patient and have them evaluated. It is very important for you to understand what the state of the patient is. Okay, is this understood? Has this been clarified? Is there any doubt in this area? Okay, I think we'll continue for now. If there are any chat doubts, we will see them a little later on. Okay, now talking about it becoming a full-fledged aspect of your life, you have to start to see how this conflict or how this trait starts to precipitate as disease in the body. Okay, now you have to understand dysfunctionality at the level of the mind is also a disease. Even if you do not have a good diagnostic name for it, clinical name for it, it doesn't mean that the patient is healthy. Okay, so you must see how it precipitates. Now, broadly speaking, the way anxiety is manifested in all of these miasms. I will just give you an outline. Of course, there will always be areas where you might have gray areas that are there, but overall in SORA, you will see that there is a sudden shift. Okay, the patient is healthy, they're fine, everything is okay, and there is a sudden spike that occurs. So usually you will have high intensity anxiety, you will have very strong symptoms with a lot of strong physical manifestations also. So typically when you see children who get scared, they develop fever, they will develop tummy ache. Okay, so very, very strong, high intensity symptoms, but they last for a very short period of time. All right. And the moment that episode is over, the child or the person comes back to normal, they are functioning fine, their physical levels and their activity, everything is on point. Okay, you do not see them feel very drained, you don't see them feeling very the recovery period is not very long. Okay, they come back to normal very quickly. So that is something that you will see in SORA. People in SORA do tend to be very dependent, they do tend to want a lot of support around them a lot. Okay, now again, like I said, if this situation continues and it becomes a habit formation, you will see the patient shift into psychosis. Now what happens in psychosis is that one is it is stagnation that occurs. Okay, so like I told you, the patient tends to become very preoccupied with the situation. It almost feels like they're stuck. If you listen to a lot of people, they will talk about the same thing again and again and again and again. It looks like they're still living in the 1960s or the 1970s. They don't come out of it at all. All right. And that stuckness is something that is very typical of psychosis. The second thing is an excess that is present. Now, since they have not resolved it, since they are not feeling healthy about it, they will try to manipulate the situation and try to fix it in their head constantly by worrying and resolving it constantly. They will, like I told you about the cycle of doubting and worrying and then going round and round and round and round, right? So that again produces a lot of preoccupation and closing that is there. So a lot of these people you will see are really self-centric, that they'll only be thinking about their problems, they'll only be discussing their problems. The first thing that they will do is only about themselves. Okay, you will find them to be very not empathetic at all. They will not have a lot of they won't be social butterflies, they won't be people who talk to others and look at other people's lives from a perspective of strength, that they won't say, okay, let me come and help you out, let me see what I can do for you. They won't do those things because they're just so preoccupied in themselves, and everything just circulates around that one problem again and again and again. Okay, so that is a very typical presentation of a psychotic anxiety. Now, what this is going to create is, since all your senses from outside, they're coming inside, what is going to happen to the susceptibility? Is it going to be high or low?
Low.
Very low. Okay, it's going to be very, very low. So people are not going to react to situations outside. They are not going to, they won't be bothered. You've also seen a lot of parents who are anxious. They will not be as worried about the child as they are about their own health. Okay, so what starts to happen is the reactivity starts to go down because the entire focus is brought into the body. Okay, or brought into the mind. Okay, then when this continues consistently without any relief, the patient starts to become frayed. They become fed up, they start to really lose their tether, right? And that is when you will see it start to go into the tubercular miasm. Tubercular miasm is the last bit of health that is remaining before the body and the mind decide to give up altogether. Okay, so it is literally like that horse that is being flogged, and for that last 100 meters, it will run really fast, but then it will collapse at the end of the line. Okay, so tubercular miasm, you will start to see that the patient really starts fraying. Okay, and although like in SORA, you will have heightened responses like high intensity anxiety, high intensity palpitations, very reactive patient, you will see all of that. But one is you will see an element of violence coming in. Okay, so if they get scared, a soric patient might go and hug the parent or hug the spouse very hard. The tubercular patient will start to nag them that you do something to fix this. I just can't take it anymore. I can't. I'm just at the edge of my mind. I have to go crazy after this. So there is an aggression and a violence that comes into the tubercular miasm. Okay. The second thing is, once the episode is over, or even during the episode, the patient collapses, the weakness, because all of your resources have been finished at this point. So the patient's recovery periods are extremely long. So you will see high intensity of symptoms, violent and aggressive symptoms, right? And you will see exhaustion. Exhaustion is a key mark of tuberculomyism, and recovery period being extremely long. So in SORA, if the patient is improving within a day or two, a tubercular patient will take 2 to 3 weeks to come back to normal. Okay. And in the end, you get syphilis. Now, syphilis is when the mind and the body have just given up. They're saying that, okay, fine, I don't care what is happening, I'm done with this. So, what starts happening in syphilis is you get extremely violent, or you will have completely closed off presentations. So, for an example, person will completely stop socializing. They will cut off from social media. They will, stop answering calls completely from people. Okay, they will start to have genuine thoughts of suicide, and they will start to think of ending their life. Completely given up. And again, this is a very low susceptibility state, but there is a lot of degeneration that occurs in the sense that the patient just doesn't come out of it anymore. In psychosis, a person can still be pacified. They can still be told to, the family, if they intervene, then they can be cajoled into coming out of the situation. Syphilitic patient will completely go into a depressive state, and they've just decided that this is no longer a useful process. I don't think I want to come out of it anymore. Okay, so that is where you will have self-destructive issues like not having a bath, not sleeping in the night, not eating correctly, starving themselves. All of these processes where they no longer have any love for themselves or any love for their mind or their body, right? And of course, we spoke about the fact that the mind and body are correlated. So we're going to talk about the physiological effects of anxiety. Now, acute anxiety, first thing is you're going to go into the fight and flight response. Everybody knows of this, right? You have an adrenaline rush, and what starts to happen is the patient feels extremely threatened at that point. Okay, now one thing you have to understand is your body and your mind, the programming that is there, no matter how much we have progressed mentally, thinking that, okay, we think so much about other things, our cortex is so huge, we have so much of understanding of social norms and all of that. Your body and your mind are still programmed the same way cave people were. Okay, so that functioning is still existent at this point. So the moment you feel threat, your body and your mind are going to decide, like, listen, I'm going to save you first. We'll think about the rest of the world later on. Okay, so when there is a threat, what starts happening is that the brain processes it and releases a large dose of adrenaline. Okay, so you're going to have increase in heart rate. If there is extreme fright, then you might even have loss of bladder control. You will have a lot of shaking, dilated pupils, so you'll have a lot of tunnel vision. You all know what tunnel vision is? That hyper-focusing. So imagine there is a lion running behind you. You have to hyper-focus on what is in front of you. You don't have time to sit and look at the scenery. You don't have time to look at what is in your surroundings. You have to see the path ahead of you, and you have to be hyper-focused so that you can jump or dive or do whatever it is required to save yourself. Okay, that is fine as long as there is an actual lion behind you. But when you are only stressed, if you start to have this sensation, you have a feeling of tunneling that happens. Okay, hyper-focusing of a situation that occurs. You will have dryness of mouth, slowed digestion, okay, and you might even have hearing loss. So this is extreme cases of anxiety. So what you would ideally call as a panic attack. This is something that, again, if it is circumstantial, genuinely you are threatened by something outside, or a person who has a very low threshold for stress. Okay, so panic disorders, we can speak about it a little later on, but this is what you will see occurring physically. So you have an increased heart rate so that all your major organs get blood flow. You have increased breathing, again, to improve oxygen intake. Pupil dilation occurs so that you can have good vision. Sweat production so that you can regulate your body temperatures correctly. And all of your non-essential organs are compromised at that point. So your digestive system, urination, salivation, your skin, all of these things are compromised at that point, because your body is saying, see, first you be alive, then we will think about thriving properly. All right, so that is how your mind and body function at a primitive level. If this continues, your body decides that, okay, you seem to be in danger all the time. All right, you always seem to be worried and you always seem to be in danger. So what we'll do is we will keep you in survival mode constantly. We won't put you in living or thriving mode, we'll put you in survival mode. Okay, so it releases cortisol, corticotropin releasing hormone, which releases cortisol. Okay, Now, as homeopaths, we all love to say steroids are bad for you. Don't take steroids. Allopaths prescribe steroids a lot and don't take it. But what we need to understand is when we are constantly stressed, our body itself is producing these steroids on a medium to high basis. Okay. And yes, in the short term, in survival mode, it is very, very important. But in the long run, it is a very dangerous thing for us. Okay. So I'll just go to the next slide. It will be a little bit more. Yes. So what these steroids do is first, they are anti-inflammatory hormones. So when your body is genuinely in a state of acute stress, this is very important. But when we are fine, we are, going through our lives, if you start to see this suppresses the immune response and it makes you liable to a lot of infections. That is why a person who is stressed a lot or who's anxious a lot is very prone to recurrent illnesses occurring again and again. Okay. It prevents the overreaction of the body to their own defense mechanism. Again, in a short-term basis, very important. It affects cell growth, proliferation, and differentiation, and it causes immunosuppression. Also, it suppresses cell adhesion, antigen presentation, and chemotaxis. Okay, and it increases apoptosis, that is cell death. So you have to understand in the long-term basis what this is going to cause you to do is function in a very poor manner. Okay, your body is constantly using all its resources to keep you alive because it thinks that it is constant. Your body is going to die at any point of time. Okay, so prolonged effects of cortisol, it causes allostatic load, that is constant stress that it changes your body in particular ways, right? It causes fat deposition, it increases lipid production, it causes your high blood pressure to remain high. So it increases the load constantly, and this can produce damage on the long run. It causes hyperglycemia or reduced insulin resistance, in the sense that there's a chance of diabetes forming. It increases your visceral fat, it increases your blood pressure, and it can even cause changes in electrolytes and reduce your immune response. Okay, are we good so far? This is the dissection of anxiety in general. Now we will go into the therapeutics and cases.
Yes, ma'am, we can proceed.
Yeah, okay. So when we are approaching a patient in homeopathy, we're going to look at it from 3 aspects. The first aspect is your acute. Okay, if your patient comes in extreme anxiety and comes in an extreme distress state, how to reduce it right now and put them in comfort. The second is breaking the pattern that has already been established. So your chronic case taking that is there, and your ancillary measures, that is what you're going to talk to your patient and teach them how to come out of these bad habits, even your mental bad habits or your thought processes that have developed, and start to lead a good life. All of us know that yes, yoga is good for health, deep breathing is good for health, but it needs to be given in a manner where the patient can understand these things. Okay, all of us know these things. YouTube and Instagram have made it very easy for us to have access to this information, but you must understand, as a homeopath, it has to be tailored to your patient's personality. Okay. Okay, so in acute stress, this is an LSMC format. This is something I usually use to take my cases. It has been used very commonly in all of our colleges also. It is a very easy and a very thorough way of taking the case. Okay, so location, this can be used for anything, not just for anxiety. It can be used for any kind of case taking. So you will talk about the location, the origin, duration, progress, and frequency. All right. So in origin, you want to talk about whether it was a quick-paced or fast-paced onset that was there. Has it lasted for a very long time in duration? How it has progressed, whether the patient is still reasonably in the early stages or whether it has progressed into something that is very dangerous and life-threatening, the frequency of the episodes. Okay, so you want to talk about how many times in a day the patient suffers from this, or how many times in a week the patient suffers from this. The utility of this is in your follow-ups. Okay, once you start giving your medicine, you will start to understand that the patient's frequency starts to decrease. So the patient may not initially find any decrease in the intensity of the symptoms. The patient might still have the same kind of episode, but they will start saying that I used to have it on a daily basis. Now it happens only once a week or once a month. So that's a very good indicator of your medicine working out. In your sensations, you have to ask about the sensation at the level of the mind, what we've already spoken about, the emotions felt, the behaviors that are displayed, your dreams, and any sensation at the level of the body. So symptoms that are directly related to stress or any kind of somatization that occurs. Okay, somatizing means that any kind of stress in the mind has directly precipitated in the body as some kind of physical symptom of some kind of physical disease. Okay. In the third category, we're going to talk about modalities. The first thing is going to be ailments from. Now, ailments from are also two kinds, right? The initial event that started to cause it. Okay, so the person who maybe had a near death experience or a very public humiliation, the first event that caused them to lose their threshold and then start to become dysfunctional. Okay, then the second thing is your triggering factor. Now, this triggering factor can be work, it can be some kind of activity that they need to do, like traveling. So you try to get two kinds of ailments from as much as is possible. Modalities of time, when is the symptom worse? Now this can help as far as your miasm is concerned. Usually some markers like tubercular syphilitic miasms are usually worse towards the end of the day, post in the night time. Okay, so modalities of time can help you, and modalities of circumstance, both amelioration and aggravating factors. Okay, both of them need to be taken into consideration. So one of these cases which I had recently, where the patient would have very strong anxiety episodes. Okay, she would be very anxious, and she was a young girl. She was about 22 years of age. Young girl, she would come saying that she had extreme anxiety. Now, usually somebody that young does not really worry too much about death and illnesses. All right. The patient was very anxious. She feared that she would die, or she had some dangerous illness. Now, what troubled her is the anxiety produced a lot of unusual physical symptoms in her body, and nobody was able to give her a clear-cut understanding or diagnosis of it. So she was very hassled that something very major had happened to her in her body, and no one was able to give her relief by giving her an explanation. Okay, the feeling of anxiety on the chest, she would feel that there was some kind of weight here. It was very difficult for her to inhale. Okay, and she would have a very, very heavy and strong palpitation. So that would make it even more difficult for her to breathe. There was heaviness all over the body, especially in the legs, as if she couldn't move. There was a faint feeling of weakness, almost as if there was a sensation of being paralyzed. And typically she would say, doctor, it just feels like everything is draining out of my body. There is numbness that is going along my limbs, and I'm just feeling like things are just leaving my body. That was a very unusual thing that she spoke about. Okay, ailments from discontented mother. So she was very unhappy that her mom was not giving her freedom. She was not. She was a very overbearing mom. So she would be very protective, but also very suffocating to the child. Right. So she was very discontented with her, that she doesn't understand what I'm going through. She doesn't want to give me space. She doesn't want to leave me alone. All of those things. There was a modality of the nighttime. All these symptoms would start to become worse when the patient had finished the day's work and was settling into bed. She would start to have all of these symptoms. And anytime she received any kind of bad news, she will start to panic. Now, this bad news did not necessarily have to do anything with her parents. It could be some random person, neighbor, auntie she had heard about. She will start to panic, and she would worry that something bad is going to happen to me also. Okay. Now, by just this picture, we had tried our basic remedies of arsenic. We had given our basic remedies of aconite, okay, gelsimim. All of those things were already given, but the patient had not improved. She would say, okay, I'm feeling 10% better, 20% better, but doctor, it's still happening. I'm still not good. Okay. So then we went a little deeper into it, where the patient would feel extreme anguish, right? She would worry that these symptoms would not leave her, and this is how she would have to live her life through and through. Okay. She would call all of her neighbors. Now, she was 22, physically fit, but the number of ECGs this child has had is insane. So many. Every week or so, she would find herself in the emergency room, getting herself an ECG. And what would happen is she would involve everybody around her. She would call her parents, she would call her friends, she would call her neighbors, she would go and ask them for help. Again, something that you would see in aconite very often, right? That restlessness that is there. She would try and ask everybody for help. Then she was also like I told you, she was very disappointed with her parents for not being able to help her. She would always say that, see how much I have done for them. I've always been a grown up. I've always helped them out when they were anxious. But now when I need them, they are not there. Despite the fact that her parents would take her to the hospital. They would try to pacify her. Just the frustration of this entire situation would cause her to become very upset and harrowed, and she would start blaming her parents. Now, the most characteristic thing about this symptom was, this case was the symptoms on the limbs, right? She would feel that drawing, that numbing, paralyzing sensation that would go through and through her body during this entire episode. Okay. So like you see in this repertory sheet, that you see that there is discontentment, that is the main ailments from that is that she's just upset with her parents, and it's something that is maintaining this. There is hysterical anxiety, because at that point of time she would just lose her senses and she would become almost, you could not console her, you could not reason with her at that point of time. Okay, she would be beside herself and have despair of recovery. And we tried, like I told you, we tried arsenic, we tried aconite, we tried phosphorus. Since she was lean, thin, we had all of those remedies that came into our repertoire. Nothing really helped her out. And finally, we saw this one remedy of Theridion. Have you all heard of Theridion? Spider group remedy. Yeah, so spider group is very typically, if you all know, spiders are extremely sensitive, right? And they usually have a lot of nervous element in it. So she had something known as nervous neurasthenia, okay, which is something that you saw that she was having all of these sensations that were very related to the nerves that were there. Okay, this drawing, pulling kind of sensation. The second thing you see is the restlessness, almost to the extent that she would trouble everybody around her. That, you know, I'm sick, you better come and you see me. Okay, I'm important to you, you better come. Not that she meant it. It was obviously not in her conscious awareness that she was doing it. Otherwise, she was a very sweet child. But the thing is, in that moment, that aggression and that annoyance started to come, that I am important, you come and solve my problem. Okay, that started to come into her. And of course, the sensitivity to the smallest thing, that bad news somewhere was troubling her. Okay, so we gave Theridion, and honestly, for me, this is the first time I have prescribed this remedy from in this context. Usually, you think of children who are troublesome, very sensitive to music, very sensitive to noise. Those are usually the symptoms you think of in spider group. But in this particular case, we saw that this nervous neurasthenia. Neurasthenia is an old-fashioned term that is used for any disorder related to the nerves or sensations that are related to the nerves. We gave her Theridion, and she improved really, really well post that. Right? So we introduced Theridion to her. She recovered by overall 30%. So by 30%, I don't just mean the intensity of the symptoms, but the frequency also started to drop significantly. All right. The patient then later on, this had started in July. Then in November, when we took the case again, she's saying the symptoms are only mildly present and they would occur only before menses, right? And we increased the potency. So suddenly she had one episode where she had a argument with the mother, and that again triggered her irritation, and then again it triggered her anxiety. So if you're able to understand this, what was happening is her suffocation was starting to make her very annoyed, and she was starting to worry when she could release herself from the situation of living with her parents and start being independent. And she did not see any pathway that would bring her out of that situation. So you're seeing vexation and irritation being the ailments form or the initial starting point of this, feeling suffocated and feeling trapped, which was not allowing her to express herself fully and live the life she wanted. This was leading to her having anticipatory anxiety, and it was starting to become almost agitational anxiety. She was going to the fact that she was starting to become very nervous, very agitated by the situation. Okay, so that is when we bumped up the potency from 200 to 1M, and by January she completely settled. She was completely fine. There was no difficulty in her at all. Okay, so this was a case of acute anxiety. This was not something, otherwise she was a well-functioning person. She worked well, she had a good social life. She, even with her parents, otherwise her relationship was very cordial. She managed a lot of things, very mature person, apart from this particular situation. Okay, so whenever you are selecting an acute or phasic remedy for your patient, you should usually ask them the way they present with the acute episodes, and have 1 or 2 remedies close by to help them out. Okay. Usually these acute remedies are related to the chronic remedies. Okay. We will see one of the cases later on where this remedy relationship can help you out. So more or less, they can either be from the same family or they can be remedies that follow well or are complementary to each other. They're very close by. Okay. Usually you should then train your patient or educate them about. Now we don't have access to our patients that easily, especially during COVID also we couldn't meet them or they couldn't come to the clinic that often. So educate your patients to first anticipate the triggers, identify and anticipate the triggers, look at the aggravating modalities and stay away from them. During that episode, just stay away from things that are going to cause you a problem. Have ameliorating modality. So if you know you're starting to develop anxiety, if you know that music soothes you, start to listen to it at that point so that it does not escalate. And take the remedy that is indicated immediately after you start to have the symptoms. Don't be a hero and wait till your anxiety has peaked, where you are panicking, your family is panicking, your neighbors are panicking. Don't wait up to that point. Start taking the remedy immediately and then get in contact with the physician. If you don't have access, especially if it happens at night, your phones are not working, the doctors are not available, then start educate them to help themselves out during this process. Of course, tell them that don't be haphazard, don't over medicate yourself, don't have too many doses just because you're feeling stressed out. Titrate it accordingly and give them a time span that you can repeat the dose every 2 hours or 3 hours, depending on the intensity. Many times, what helps is asking your patient to rate their intensity from a scale of 0 to 10. Okay. So if they are, what she was experiencing was more or less at a scale of 8 or 9. So I told her you can take the medicine as the moment you start to feel like it is a 4. Okay. You start taking a dose. Don't repeat it if you feel that it is reducing. But if you feel that it is increasing in its intensity, you can repeat a dose after 2 hours. So like that, once you can educate your patient so that they can become a little self-sufficient and make life easier for themselves and for you also in the long run. Okay. We are going to go into therapeutics of fear and anxiety. I have only taken a few remedies in this. Of course, a lot of the other remedies will also be included. Okay. So here we are talking about anticipatory anxiety or anxiety in broad spectrum. Okay. 1 second. My screen is not, just give me 1 second, please. Right. Is it okay if I share it like this? Is that instead of the whole screen? Is it okay?
No, ma'am, it's too small.
Because
maybe we can do the Zoom. Yeah, we can see it.
You can see it. I can't see the names because the screen is blocking it. Okay. So
anyway, what we can do is, ma'am, in case just zoom the PPT.
Yeah.
Go back and increase the font size.
No, I don't think it will work out. Just give me a second, please. I'll just look at the names.
I'll help you with the names, ma'am, in case there is any.
Yeah, no problem. Okay, so first remedy is aconite. You usually have, this is a very well-known remedy. Almost all of us know about it, but we don't use it that much in practice, right? Aconite is the first remedy that you're going to think of when there has been a major shock or there has been a major fright. Okay, like a child that has been scolded very badly by the parent, or they have been chased by a dog, or somebody who's got bad news. Okay, I've had a lot of patients who have come to me from other doctors who have threatened them that if you don't do this, you are going to have a heart attack. Okay, and they get really frightened. They suddenly think, okay, I never thought that I would fall sick. Okay, so the fear of or the fright of listening to some terrible diagnosis can also be one of the ailments from that are there. Okay. So what happens is that this patient becomes very excited, very excitable. Okay, you will see it even on their face. They will start to become flushed. They look very harrowed. Their eyes will be big, and they'll all be, anybody who is harrowed will have this forward leaning posture as though they're just going to jump out of the chair at any point of time. Okay, they're very excitable. There's a lot of restlessness. Now we know this as one of the trials of restlessness, right? But aconite has the symptom of both physical and mental restlessness. So what happens is their thought processes are so continuous, they go into a loop and they try to pacify themselves by being by taking action. So either by pacing restlessly back and forth, or they will try to call as many people. So there's one of the symptoms that they have is texting all of their friends and asking for validation from a multiple number of people. Okay, so they tend to placate themselves by any method that is possible. Okay, so there is extreme restlessness, fear of death. Okay, and there is a lot of tossing about. Okay, now the thing is, usually aconite is not indicated for a person who is in danger. They are usually very healthy, they are very happy people, and they just suddenly get a shock. Okay, so when they come and they ask you, they have a little bit of trepidation themselves. They will think, doctor, is something going to happen to me? And many times we will miss out aconite in this particular area because we've always associated them with being very hyper, right? But they usually ask, you will think of a tummy ache or you will think of a headache, and the person will come and say, you don't think I have a brain tumor, right? I'm not going to die. You're sure, right? So that usually you need to be a little careful about finding this out while you are looking at the case of aconite. Of course, along with this, their nerves go on hyper mode. So they're going to be physically sensitive to everything. Okay. So they're going to be oversensitive to light. They're going to be oversensitive to sunlight, noise, unpleasant odors. Everything irritates them. And usually, since it is a plant, it is going to require a lot of dependency. Aconite usually loves their doctors a lot. Okay. They're very, very fond of the people who help them, and they cling on to the doctors a lot. Okay, and they do not think of the time of the day, they do not think of the person involved. They will call you up at 12 o'clock in the night also if they are worried. Okay, but at the same time there is very genuine fear. They are not doing it out of spite, they are not doing it out of aggression, they are genuinely harrowed by the situation. Okay, now typically, like everything else, the dark causes a lot of anxiety. So you will see that there is an aggravation at night. There's aggravation by violent emotions, by cold. Okay, because their nerves are on edge and they are so worried about things, they can't even handle any kind of draft or any kind of cold onto them. Also, typically those kids who have cold drinks during their night outs, and then the parents will come and say, oh my god, how can you have something so cold, you're going to fall sick. Invariably the child will fall sick the next day, right? The patient is usually better by open air, by warmth, warm perspiration, and better by rest. Now, this is a very important thing, that aconite is better by perspiring. It is very important for you to see this symptom, that the patient feels better when they are little warm and they tend to sweat a lot. The second one is gelsemium. Gelsemium is an amazing remedy for anxiety. Okay, it is a very gentle, very sweet disposition. They usually tend to have, again, very similar to aconite, they tend to get frightened. But unlike aconite, which tends to become very reactive, gelsemium becomes very mellow. So they are like, they cocoon themselves inside. Okay, they're very timid, so they go off inside, right? There is a lot of apprehension and timidity. So what will start happening is that they will avoid situations as opposed to aconite, which goes and tries to take action. Okay, they will try to go away from, so they won't attend dinners, they will not attend phone calls, and right now I am already stressed and I just can't take anything anymore, so please just stay away from me. Okay, so they tend to close off. You will also start to see that preoccupation of the anxiety is so much that they will start to lose their willpower. Okay, they won't feel like exercising anymore, they won't feel like working anymore. Even if somebody calls to find out how they will not answer the phone. Just, Mannik, I just don't feel like it, I just know I don't have any energy to do it at all. Okay, there is a desire to be quiet, and they have an aversion to being disturbed because they are so worried, they don't want to listen to anything. So that is why you see ailments from bad news and aggravation from bad news being there in gelsemium. They are so worried about receiving more unsettling news that they just want to cut away from everything. They'll stop, they will uninstall their social media apps, they will stop watching the news, right? They'll just shut themselves off so that, if I don't hear it, then I don't need to worry about it. Ignorance is bliss. Okay, so gelsemium tends to be that timid and that troubled by situations, and then you will start to see that dullness coming in, right? So the hallmark of gelsemium being dullness, dizziness, drowsiness, right? Sleep is a very, very important coping mechanism. When your body and your mind cannot handle situations, your body will just say, go to sleep. You don't need to look at this right now. So that is why when you are very stressed and you don't want to handle that situation, you will find yourself sleeping for long periods of time. Okay, so in depression, you do see that people tend to sleep for a lot of time. It is almost like your mind is escaping from the reality of life. Okay, so this in gelsemium, you will see that this timidity or this frailty that this patient displays, they try to protect themselves as much as possible. So you will see them becoming dull, you start seeing them isolating, you start seeing them becoming very, very drowsy. Okay. Of course, you might get mild giddiness. It may not become full-fledged vertigo like in a neurological case. You might see mild dizziness, unsteadiness that is there in gelsemium. Okay, the patient is worse by thinking about the ailments. Like I just told you, they will avoid stressing themselves out as much as is possible. Okay, and they will try to run away from the situation. It is literally like avoiding something you are frightened of. Like if there's a dog in the room that you're worried about, you will just keep a healthy distance away from that factor which is causing you trouble. So gelsemium does this at a mental plane. Okay, they will just avoid anything that troubles them. They're usually better by alcoholic drinks, mental effort in some other situation like a crossword puzzle or reading a book or something that will divert their mind from the situation. Bending forward, closing eyes. This is more to do with vertigo than the anxiety, but generally the patient is better by relaxing and trying to forget the situation. Okay, and better by open air. Now,
Calcareas.
yeah, this is a very, very interesting remedy. Okay, now you think of calcarea and arsenic both. Both of them are known to be anxious patients. All right, both of them are known to be people who calcarea. Everybody knows, gentle souls, very sweet people, very structured, and typically like those soft-bodied animals that want to go back into their shell. They'll peek themselves out. If you've ever seen a snail coming out of its shell, you will see how they are. They'll come out, they'll put one antenna out, then another antenna out. They'll see if the environment is dangerous. The moment they see any kind of danger, they will withdraw back inside. So that is a very typical calcarea, that I want to be protected and I want to be safe. Okay. Now you have arsenic, which is also very anxious, but they are very proud of their intellectual capacities. Okay. So it is a very, very thinking kind of drug. So arsenic will try as much as possible to think of the situations that are wrong and come up with a solution. And that is the reason that they are fastidious. That is the reason they are perfectionists. That is the reason they also tend to be extremely critical. Okay. Now, calcarea Rs is a brilliant blend of both of them. So you are going to have a patient who is ridiculously anxious, but also who is sensitive but smart at the same time. Now, the problem with calcarea Rs is they don't want to admit that they are worried. Okay, they don't want to pretend because they're so proud of their intellect, they're so proud of the fact that they are smart, they don't want to admit it. So what starts to happen is that the patient tends to rationalize. Calcareas can be mistaken for lycopodium very often. Okay, they tend to rationalize their concepts a lot. So in the mind, you will have a sensation of floating or gliding towards the air or heavenwards. Now, this is obviously not a symptom that is very easily expressed by the patients, but they will talk about a sense of being disconnected from everything. ऐसा लगता है पता नहीं मजा नहीं I mean, I don't feel like I'm having fun. I don't feel involved in situations. A general sense of disconnection starts to happen. Okay. Especially when he is feeling extremely anxious, what will start to happen is that he will start to feel elevated. I haven't really had too many patients coming to me and telling me they feel like they're flying or they're swimming, or he feels like the feet don't touch the ground. But he will generally say that, I don't know, I'm just not feeling normal. I feel very disconnected from everything, feels weird. Okay. They usually tend to speak of something that is very abstract and something that you're not able to hold on to. And there is a fear of death. Now, this is seen both in arsenic and in calcarea, right? Fear of death. Usually, calcarea Rs patients will anticipate something. So, if a person is diagnosed with high blood pressure, he will come and ask you for medicines for a heart attack. So, you start medicating me from now so that I don't develop it and nothing will happen to me. Okay, so you will see that their anticipation is channelized into them taking action in a very structured and a very intellectual manner. But because it will be out of bounds, like it will be unnecessary, right? You can take medicines for high blood pressure. You don't need to think of a heart attack so early in the diagnostic phase. Okay, so usually they tend to be, they're very proud of the fact that they can think of these things, that see, I'm such a smart person, I can look so far ahead and anticipate it. But it's also very exaggerated. You don't need to be that stressed out also.
Okay, calcarea arts is also indicated in people who tend to have a lot of alcohol. Now, anybody who's suffering and struggling with anxiety and goes into drinking alcohol, that's usually not a good combination, right? Because although the initial calmness is nice for the patient, then secondary reaction is that the patient starts to have a spike in the cortisol levels and become very, very harrowed and starts to panic. Okay. And the element of arsenic is again seen in this drug where you have extreme palpitations. This is something that is very important, right? A constant feeling of fluttering in the heart and constant palpitations that are there by the slightest exertion. So you see the combination of calcarea and arsenic. Calcarea is usually aggravated by the slightest exertion in any form, either mental or physical, and arsenic will result in its extremely high palpitations. Now, in physical appearance, usually these people are quite stout. Okay, they're fleshy like calcarea, and they tend to have a very ruddy complexion. They tend to be very flushed and nice. They have nice red cheeks. This is an observation I've had quite often. Okay. Again, like calcarea and arsenic, they are not happy with anything cold, so they're usually aggravated by cold weather, better by rest and open air. Okay, they don't like a lot of exhaustion, so they tend to do things very slowly, very mellowly. They'll take their time to do things. So going out on a slow walk is usually something that ameliorates them. And the last one is
Stramonium.
Stramonium. Stramonium is your fear remedy, right? We've spoken about the mania remedies before. You must have heard about them. Belladonna, hyoscyamus, and stramonium. Now, the crux of stramonium is whatever they are suffering is because of some kind of fear, and usually this is a fear that does not have is usually metaphysical in origin. So it can be either the devil, it can be a ghost, it can be paranormal activity, it can be God. Okay, if they come up been brought up in a background where people have put the fear of God in them, saying that if you do this thing, then God is going to sing you. You know, a lot of people, especially from the rural background, have been indoctrinated by such kind of things that, oh, if you perform this particular activity, then you'll be boiled in oil for how many other years in hell. So usually that fear is so ingrained and it is so possessive of the patient, right? It completely occupies them. Stramonium is a remedy that starts to go into the tuberculosyphilitic miasm, okay, where the patient starts to fray. They start to tend to lose the sense of reality. They start to lose their common sense and they start to become just that little crazy. Okay. There is a strong desire for, I'm sorry, this is being blocked again. Just give me a second. Yeah, there is a strong desire for light. Okay. Now, this is both metaphorical and literal. You can't see what is happening in the dark. You don't know what is going to happen. So the patient wants to be in light all the time. He wants to know things. He wants to be able to have access to everything that is happening around him so that he knows what is happening and he is not threatened in any way. Again, just like light, strong desire for company. So if something happens, at least somebody is there. Okay. They live in extreme intense vulnerability. They feel like their life is in danger all the time. Okay. So you have to understand this puts an extreme strain on the system and the patient gets very harrowed. Okay. And this precipitates in all kinds of fears. So fear of insects, fear of animals, fear of unknown entities, fear of closed places, anything. And usually the way the patient expresses himself is through beseeching. Okay, they beg you to relieve their symptoms. They beg you to do something. So either they'll beg you or they will pray to God. Okay, and the way they come and say is that I beg God to get me out of the situation. I just cannot handle it. Okay, now imagine a person having this high intensity of stress in the mind. They will fracture very easily. And that is where you start to see the violence of stramonium coming in. Just because they cannot handle the stress, because it's like a caged animal, right in the corner of a cage, who's so scared, they will attack you. Okay. So stramonium is that kind of patient who is so stressed out that they tend to become violent just because they're not able to tackle the stress anymore. Of course, in the physical generals, you will see that there are reduced secretions. We saw this in the adrenaline rush, right? When a person has a fight or flight response, there is general dryness and general reduction of secretions. And you will see that all your high intensity remedies will have dryness in them. Belladonna has it, stramonium has it, right? Because your body is just so high on adrenaline all the time that your secretions tend to get reduced. Now, with that reduction in secretions, you have a violent thirst, especially for sour drinks. sleeplessness in a dark room, almost all my Stramonium patients will have the need to switch on a light while they go to sleep. And usually it's a bright light, not a small night lamp, but something that is bright, right? They are worse after glistening objects, after fright, after sleep, in the darkness, to the extent that they don't even have, they don't even appreciate dark, cloudy weather. I actually had a patient who came and told me this. Doctor, I can't stand monsoon. So in India, we have like a good chunk of 3 to 4 months where we have only rain, right? The skies are clouded with dark clouds. You can't see the sunlight for days. And she said, I just cannot take that weather. It is so difficult for me to function. I'm always scared. I'm always threatened. I hate that season in India, right? So they actually do not like darkness, even to the extent of having bad weather, right? And they always want bright sunlight. The patient is better by light, better by company, better by warmth and cold water. Okay, so now we're going to go into agitational anxiety. Now, yes, Twinda, I need your help again. I'm so sorry.
Yes, ma'am. Argentum nitrate.
Yes, we know this remedy so well for anxiety, right? It's one of the first remedies we learn as a homeopath, and it works beautifully, right? Now, the concept with Argentum nitricum is to understand the mentality of a person who comes second, right? No matter how well you have done, you're always going to be second. Okay, you're always going to be not the best. All right. So that insecurity or that thought process or that inability to perform and succeed in a particular situation is what causes the anxiety in Argentum nitricum. Okay, they always feel they have to prove themselves. They always feel that they are lacking, and they won't be able to manage the situation well enough to come out a winner. Okay, so you will see ailments from anything that is performance oriented. Okay, so ailments from engagement, social engagements, ailments from giving exams, or ailments from doing something that like a job, right? Something that gives them that anticipation of performance, right? Now, in Argentum, you will see both mental and physical symptoms being very, very intense. Okay, you have impulsiveness, you have hidden irrational motives for actions. Okay, you will not understand why these patients do certain things. Now, one of the interesting aspects of this is people who develop superstitions. Okay, if I put my right shoe on first, only the rest of my day is going to go well. It may not make sense to you, but for that person, it is almost like a reassurance that, okay, at least I'm doing something right, things will go well. Okay, there is anxiety from exaltation of fancies, right? In the sense that he will imagine situations and then he will create anxiety for himself. And you will start to see that the patient becomes very, again, very, very aware of his surroundings, and he will start to anticipate things going wrong. So that is where he will start to worry, is there someone hidden in the corner of the road waiting to jump out on me? Is there a bus coming from behind me that's going to mow me down? Okay, you will start to think of all of these scenarios. And once the mind has taken control of the situation running at 100 kilometers per hour, what starts to happen is the body tries to catch up to this. Okay, so he'll try to get out of this situation as much as is possible and try to perform well at the same time. So you can imagine the kind of duress that an Argentum patient puts onto himself. Okay, so this patient will start to become very hurried, very hasty, tend to stammer, stutter. Okay, and their actions tend to become very impulsive and erratic. All right, you will also start to see a lot of physical symptoms appearing in Argentum, like physical trembling. You will have a lot of nervousness, a lot of awkwardness that comes up. You will have your very famous nervous diarrhea that occurs. Okay, so it is an excellent remedy for people with irritable bowel syndrome of the diarrhea type. And you will see that the entire system starts to get very agitated and nervous. Again, like Calcarea, Argentum cannot take any kind of emotion. It makes them very worried. Argentums are hot patients, so they don't like a lot of warmth. Okay, they feel very trapped and suffocated, so they want a lot of freedom and open air. Sugar, they like it. Now see, whenever you're stressed, your body will ask for a source of quick energy so that in case they need it, it has access to it. But sugar invariably causes a problem. Too much of sugar is not a good thing. So you will see Argentum craving for sugar as well as being aggravated by sugar. Okay. And of course, all your other symptoms of having aggravation while going out in a crowd or engaging in any particular situation. The patient feels better by any kind of cold, either it is open air or washing with cold water. It's soothing to their very agitated system and feels better by a draft. Okay, so they feel nice when there is wind blowing in the face. Okay, the second, yeah.
Palladium.
Palladium. Now, this is a very interesting remedy, and this is something I've started to use of late. Now, palladium, we always almost think of a very caricaturous, exaggerated form, but you might see it occurring in a more mellow fashion also. Palladium is a remedy that is solely dependent on another person's opinion for them to understand themselves. Okay, they have a very fragile sense of identity and they constantly need somebody else to keep validating them. Now, when you have this kind of temperament or you have this kind of personality, what happens is that you are never going to be satisfied with anything that happens. Okay, everything is going to be temporary. So if you give a performance and people applaud you and say you're amazing, it is only going to last for 5 minutes or maximum a day. Then immediately once that joy ebbs away, you will start to look for one more source of validation. Okay. Now, a palladium patient is stuck in an endless and a very, very tiring loop of seeking validation and making him or herself anxious in the process of seeking this validation. Okay. They base their entire personality off of it. So they will dress in a way to impress people. They will talk in a way to impress people. They will conduct things. So a lot of performers or musicians or dancers are known to be palladium because they're constantly performing and seeking that external approval to make them feel better. And the moment this stops in a day of especially social media where you have so many likes and comments and interactions that occur, palladium takes up a very strong area. So you may not always think of it only as a chronic remedy, but you can consider it in a phasic way for performers or people who are there in the public eye, where they forget their authentic self, they forget their own self in during this process, and they develop an identity that is only to please people and to get validation back. Okay, so palladium is very sensitive to criticism, is in fact so sensitive that even if a person does not mean it, so for example, if she wears a beautiful dress and she goes out, even if a person does not compliment her back, she will take it as an offense. It needed go up to the point of somebody criticizing her outfit, but it can even go up to the point of her just not receiving any attention. Okay, so you will find her being extremely anxious, and the way this anxiety will precipitate further is becoming very irritable. She'll become petty, she'll become violent. Okay, she will feel offended. Sometimes that offense she might take to imagine situations also. The person in front may not have even thought of what she is thinking sometimes, right? So palladium tends to become very obsessed with how people are looking at her, what they are doing, how they are reacting. And even a slight discomfort in the environment, like a person not paying attention or looking away, is considered a big offense. Okay. And what starts to happen is that she becomes agitated and she then becomes very verbose, right? She might go and confront the person, she might go and complain about that person to somebody else. And they usually tend to have very violent and forcible language. Okay. And they have they fancy that they are being neglected. Usually, palladium is extremely sensitive to any kind of insult, any kind of humiliation. Okay. So they're actually aggravated by social functions. So although you will see that they're social butterflies, they tend to have a good social group, they are party goers. But the thing is, the strain that they put on themselves to perform is so much that any kind of event actually causes an aggravation. They're usually better by touch, pressure. Of course, they're much better by compliments. If you can tell a palladium that they're doing well, they're very, very happy. And they're better after sleep and after passing stools. Okay.
Asafoetida.
Yes, this is a very interesting remedy, and this acts very well in India, especially. Okay. Asafoetida is again a person who has been like palladium, they're very stressed out. Okay. But unlike palladium, it has nothing to do with their self-image. It is more to do with an external circumstance. So, for example, wife who has been working non-stop at home, not getting any appreciation, or a person who has been seeking a diagnosis for their physical condition and has not been getting any kind of feedback from the doctors. is not satisfied with the consultations that he or she has done. So anybody who has just reached the end of their tether and they're just very, very frustrated. So what happens is the system is tired, but is also very heightened in it's very irritated. The system is very irritated, right? So in the physical sector, you will see a lot of burning that occurs throughout asafoetida, right? But you will see this burning occurring even at a mental plane. They are seething inside, but it precipitates not in violence or aggression, it precipitates in hysteria and anxiety. Okay, so there is extreme nervousness and oversensitivity. To the extent a touch will also cause them to have a lot of difficulty. I had one asafoetida patient who had neck pain, which was aggravated by music. The neck pain was aggravated by music, not him listening to headphones or putting something close to him. Even if a neighbor was playing music and he happened to hear it, that would aggravate the neck pain. Okay, so extremely hysterical, extremely oversensitive. They tend to exaggerate their symptoms to no end because they feel very deprived and they feel that they're not getting importance. They want the person in front to be very fascinated or to be really understand the depth of the complaints they're undergoing. So they tend to be very exaggerated in their symptoms. Okay, and they also fear very often telling the doctor that they are better because they feel the doctor will stop paying attention or they will not address the complaints the way they should. They crave for a lot of sympathy and they tend to magnify the symptoms a lot. So these patients can be a little difficult when you're taking the follow-up because they never give you a satisfactory response, right? They also have a sense of a lot of faintness. They will say, I'm feeling dizzy. I feel like I will fall down. Okay, I'm very tired. There's a lot of bloating and there's a lot of burping. Asafoetida is known to be an extremely flatulent remedy. Okay, and these people tend to have loud eructations and loud burping. This might have nothing to do with their anxiety. You may feel like it's a separate symptom, but it's a very, very strong indicator. If you can find a person with anxiety who's troubled, and if they also tend to burp a lot, rather shamelessly in your clinic also, it's a good indicator to give them asafoetida. Okay. Again, because they are so harrowed, they will not like any kind of suffocation. They would not like a lot of warmth. They would not like a lot of noise to the extent they don't even like touch. Okay, so you will see like cases that they will have a desire to not be clothed in tight clothing, any kind of restriction. Okay, they want to be free and away from their complaints. So the patient is better by slow motion in open air, slow walking in open air, and better by pressure. This is a bit contradictory in asafoetida where touch aggravates them, but they are better by pressure. And the last remedy?
Coffee.
Coffee. Now, this is actually a very easy remedy to understand. If you all are feeling, adventurous, please go ahead and drink 3 to 4 cups of coffee and see what happens to your system. You will understand the state of a coffee patient very easily. Okay, so somebody who is just very, very highly caffeinated, right? It's easy to imagine also. It's not very difficult. You don't have to torture yourself by putting yourself through it. It's very easy to understand how receptive their nerves are, how how receptive they are to any kind of external stimulus and how quick they're going to be to respond to anything. Okay, so any kind of emotion can cause ailments from in coffee. I had one student who was going through a lot of anxiety and she had insomnia. She was not able to sleep. And we went through her case for weeks and weeks together. We were trying to figure out what is wrong with her. As you know, is there something that's troubling her? Then in the end, after a lot of detailed case taking, we came to know that she was just so happy to go back home that she couldn't take the happiness. Right? So that level of sensitivity is seen that even joy and good news can cause coffee to have an attack, right? There is mental overactivity. Now, this can be precipitated and can be made out when the patient talks, right? They tend to skip, and one is they speak really fast. They don't breathe while they're speaking, and they also tend to skip topics very quickly. Okay, they'll keep jumping from topic to topic, and they are very, very excited. So usually they are very cheerful, very happy, very expressive people. They don't usually come across as somebody who's very irritable or naggy, or they don't tend to be disappointed or sad. They're usually very vivacious people. but you will see that it is an abnormal vivacity. Just like how you feel abnormally energetic after drinking a lot of coffee, you will see that abnormal energy in a coffee patient. And their thoughts are also extremely quick. And usually you will tell them that they will tell you that I just can't stop thinking. It's very stressful for me. Okay, there is whirling activity, spinning, and they will start to say also that my mind is just taken off on its own. I don't know how to control it anymore. Now, this overactivity in the mind is precipitated as overactivity in the body, where there is extreme sensitivity to pain, sensitivity to all your external impressions of noise, light, sound, everything, right? And all the senses are acute. Okay, so usually they also get affected by things like bright colors or psychedelic patterns. They get overwhelmed by it very easily. Okay, and they are better by lying and resting, although you find coffee patients not doing this. They are just so restless that they don't sit quietly at all, and they like ice cold water. Now I see that this pattern has occurred, right? When you see that the body is agitated, you will see that any kind of warmth or heat is something that does not help them, whereas you see that cold and something that is soothing to the nerves that are agitated and irritated usually makes the patient feel better. And since coffee has so much of nervous irritation, you will see that ice cold water is what makes them feel good. Now we're going to depressive anxiety. Okay. The first remedy that we have is
Simisafuga.
Yes. Okay. Now Simisafuga is very well known for that symptom where they have that black cloud floating around their head. And that's literally how they are. Okay. They are very, very stressed, very depressing, very miserable people. If you interact with Simisafuga, you will start to see that you yourself get depressed after a point, right? They literally look at life from such a pessimistic, such a negative manner that it starts to irk you. Okay. Of course, you will see that many times that reason for them being anxious is also might be valid, but at the same time, you just think of them having such a terrible outlook to life that you will start to wonder why are you thinking like this? It's so depressing, right? So you will see that it is a very predominantly female remedy, and you will see that there is a lot of menstrual disturbance that occurs. Okay, so another symptom is that Simisafuga is one of the remedies that is worst by menstruation. Most of the time, when the flow starts, the female feels relieved and she feels better. Okay, but in Simisafuga, she feels even more harrowed once the flow starts. Okay, any kind of long-term mental exhaustion can also be indicated in Simisafuga. So, long-term exam preparation, especially these people who do UPSC training, right? For 2-3 years, they keep training again and again. People who are doing chartered accountancy, they also take a lot of time to pass their exams, right? So they're in that same loop for a long time. So that kind of strain can many times result in this very depressed, very, pessimistic. Abhi, there's no use. I'm going to fail this time also. I don't think I'm going to clear my exam. So that kind of very dull and disgruntled feature comes up in Simisafuga. Okay. So they also feel very constricted. A person who wants to be emancipated from his situation, wants to escape from his situation. So they feel very restricted. And that is why you see a lot of tightness, a lot of cramping sensation present in Simisafuga. There's a lot of uneasiness. There is a fear of insanity, especially before menses or menopause. Now, when a person has been stressed for so long, right, the mood swings tend to be so extreme that the patient feels that it is out of control of them. Especially many times females in the PMS situation going towards a dysphoric disorder can say that I just don't know what overtakes me during my period. Normally I'm very stable, I'm steady, but during that phase, I just lose control. I don't know why I cry. I don't know why I get angry. And I want to stop it, but I'm not able to. Okay, so they really feel like they're losing control of their own mind and their own body. Extremely loquacious, but a very sad loquacity. It is not a cheerful, happy loquacity like Coffea, Phosphorus. Those people you want to interact with, you enjoy their stories. They tend to pepper their stories with a lot of humor when they're narrating it also. So although they might be talking about their disease, they will also entertain you at the same time. Whereas Simisafuga, you also feel depressed. You must have met patients like that. When you talk to them, you just feel so, oh my goodness, so horrible, right? So they are literally like a black cloud floating around them, and they also tend to pass this off to other people. There's a lot of sighing during the narration of their symptoms. Now you will see again people who tend to be depressed. This is another remedy which you have is ignatia. And the third remedy is calcarea phos. All three remedies tend to be very dejected. They tend to be very disappointed, discontented. So you will see sighing because the patient feels so heavy in the chest, right? So that breath of air tends to give them temporary relief. So you will see people with going towards depression or depressive features sighing a lot. Okay. During menopause, during menses, or any kind of gynecological problems, the patient is very, very chilly. Now, we just went from agitational anxiety. You will see that depressive anxiety, where a person is slow, indolent, you will start to see that coldness kind of gets in and they're not able to take anything cold. Okay. The patient is predominantly worse during menstruation, especially if the menstruation is suppressed. So you will see that it's a good remedy, although it is not suppressed per se, but people who are struggling with mood swings post OC pills, right? It's an excellent remedy to think of in such cases, right? The patient is worse by any kind of excitement, any kind of motion in the morning, afternoon, and after drinking alcohol. Okay, the patient is better by warmth. Now, see, warmth is cuddling, it is protection, it is safety. So you will see all these depressed people preferring that warmth. Okay, they want to be held and they want to be taken care of. So you will see that improvement from warmth coming in a lot of these remedies. Okay, pressure and gentle motion. Okay, the second remedy is
pulsatilla.
Yes, they're cousins only. Pulsatilla is like simicifuga, but pulsatilla has a very definite thought process that you have to take care of me. Okay, the damsel in distress. So they usually, although they can come across as timid, gentle, very sweet, but they have a very clear understanding that, listen, my problem is your problem. You better get on board with me and take care of me. Okay. And the moment they stop receiving attention, they stop receiving that consolation, they will start to feel incredibly forsaken. Okay. So Pulsatilla, although is painted as a very gentle, timid lady, she can be quite bratty, all right, very demanding and extremely, I wouldn't say manipulative, but extremely demanding. They would want constant reassurance and consolation. So basically, you have to dedicate your time. A 3 or 4-year-old toddler is a good picture of Pulsatilla, right? You have to put them first and you have to pacify them and make things better. So the slightest discomfort can make her feel very forsaken. She's extremely sympathetic, but she will only be sympathetic to the point she feels that you can return the sympathy when it is needed. She might look like she's very rigid and moralistic, but the moment the situation changes, you might see these morals going away. Okay, and she usually is very happy to explain that, yeah, I know I don't really do these things, but yeah, what can I do? The situation just demanded it, right? So she consoles herself also in the process. Many fears, and usually it's a little irrational, right? So for example, if a girl is a person is married, she might listen to a friend of hers struggling with a husband who's had an extramarital affair, and she will suddenly become very paranoid that her husband is also having an affair. She will go to the extent of checking his phone or spying on him to just pacify. And the moment he stops to doesn't pay attention to her, forgets to text her, she will start to feel forsaken. That, oh my God, see, he's not bothered. He doesn't love me anymore. Usually, the way they behave when they feel like this is by nagging and demanding for more attention. That is why you have this very strong rubric of better by consoling. Consoling can go on for days and days together, and Pulsatilla will still be very happy to receive it, right? She's very, very dependent on, like Palladium is dependent on validation, Pulsatilla is dependent on consolation. Okay. There is physically, there is a lot of changeability of symptoms. That is because she's emotionally driven, and what troubles her right now will get focus. So usually it's not that she doesn't have those symptoms constantly, it's what she pays attention to at that particular time that will get that you will be told about and that will receive her attention, right? So that is a changeability that you see in her. She's better by open air and she's better by food cravings. Now, Pulsatilla is a creature of luxury. She is a creature that wants to be really comforted. So you will see there's a lot of desire for rich food, luxury. And one of the things that also causes comforting is sex, right? So a lot of the times, Pulsatilla is categorized as a remedy that is scared of the opposite gender. But you will also see that if she is in a contented, happy relationship, you will see that the drive for sex is also quite high. So that is again another feature that aggravates her. If a partner is not able to satisfy her, or if he's not paying enough attention to her needs, then again it will become a reason for her to get upset and also develop anxiety that he no longer loves her, he no longer desires her, right? She's aggravated by warmth, she's aggravated by of the room, of the bed, and of by warm food. She's aggravated in the evening, and she is aggravated by rest. Now, this reason she's aggravated by rest is because of the instability of her mind, constantly seeking that consolation. Okay, so the moment that supply stops, it makes her aggravated. So if she's sitting quietly, it is not something that is going to satisfy her. She starts to go seek for consolation somewhere. The feature of pulsatilla is that they complain a lot. Okay, they usually they're usually happy to complain to anybody who is ready to listen. So whether it is you, a physician, or whether it is her best friend or even her co-worker, everybody will come to know about their lives. And this is the contradiction in pulsatilla. There is a naivety that is sweet and that is endearing, but at the same time, it is also a little foolish, right? There is a lack of maturity that is there in the ways she presents herself. Pulsatilla is usually better by cold and better by open air and by gentle motion and better after a good cry. Okay, she is better by releasing her emotions. The third one, sorry?
Acid fall.
Yes. Now, the cousin of pulsatilla is phosphorus, right? So we are talking about remedies that come very close by. Phosphorus, right? Phosphorus is a tubercular version of pulsatilla, where they also require a lot of attention. They also require a lot of validation. They love to be the center of attention, but usually they tend to impress the people by their warmth, by their magnetism, by their performance. They're usually extremely entertaining people, right? Now, phosphorus is a very idyllic remedy. They tend to have a romantic perspective of life, and they really don't like to burden themselves by the boring aspects of life, right? So they would love to get into a relationship, they would love to get into friendship up to the point where the demands are starting to be made from them. Okay, the moment they have to consistently give, or the moment they consistently have to perform, they get very harrowed, they feel very restricted, and they feel uncomfortable. And that is the reason that you will see phosphorus being a very flaky remedy. They keep changing things very quickly, right? When phosphorus goes through this process again and again and again and again, where they just feel emotionally deprived, that they're not getting the satisfaction that they want, they're not getting the happiness that they want, they're not getting the love and the attention that they want, they start to become dejected, discontented, and then they become depressed. Okay, now acid phos state can be you can come to a state of acid phos in multiple ways. Okay, one is what I just told you, by seeking a relationship outside that will satisfy the patient, which is they go through the process of they go through the process of disappointment again and again and again till the point that they are completely depressed. The second way is when the patient may not be a phosphorus patient per se, but they're undergoing a situation that is emotionally extremely draining, right? So one of the examples of it is when you are taking care of a person who's bedridden, right? A loved one, someone you have seen who's strong and has been independent, and you are seeing them deteriorate in front of your eyes, right? And it is a very traumatic process to go through. So what happens in this case is that the patient wants to become emotionally better again. They want to have a happy interaction with the person they're taking care of. They want to be satisfied. They want to, also take care of themselves at one point. But because the circumstance doesn't allow it, they have to sacrifice their time and effort. They have to regulate their emotions to constantly address the other person involved. And also, it is a very depressing thing to see somebody suffering like that, right? Slowly, what starts happening is they become emotionally drained, right? They're eaten up from inside. And that is why they go into the acid phase. Acids are always very depleted and very, very exhausted, right? They've been completely eaten out. So acid phos, you will see the depression starting at an emotional plane and then slowly making its way into the physical plane. So you will have ailments from grief, sometimes from sudden loss, but a lot of the times acid phos comes into a phase of after a long standing disappointment. Okay, from trying again and again and again, they become extremely dejected. They lose hope, right? They become listless. They dislike to talk. They become, one is the exhaustion. They're just so tired that they don't want to engage with people anymore. And second is also the disappointment is so much that they just don't feel like having hope. That at least, patients come and say it's better not to have hope, because the only thing that is waiting for you is disappointment. I can't take that ebb and flow that happens. Okay. So that is typically an acid fast phase. They're indifferent to things that used to interest her because she's now given up on life, right? And physically and mentally, they become very weak. So mental weakness will start presenting itself as not being able to hold a conversation fully. They'll forget things like where they've kept the keys. They'll forget chores, right? They'll forget important tasks in the day. And they'll also start to become very masked, right? A person who is lively and interactive and expressive will become very dull, right? So this is the way it starts to show mentally. Physically, they will feel drained. Okay, the person will come and tell you that no matter how much I eat, no matter how much I sleep, I still feel very, very exhausted. I'm just not able to get up. And you as a person will be able to see this, right? You will be able to see the exhaustion. Many times it can actually go forward into precipitating into diarrhea and also weight loss. Okay, so you will start to see that the patient becomes emaciated. The person becomes very chilly. There is literally nothing left in them. There's no happiness, there's no warmth. So they have become extremely cold inside, and they are also susceptible to cold. Profuse perspiration that is present in the night towards the morning, and there is a loss of appetite from grief. Okay, it is not just a loss of appetite, they have a loss of interest in food. Okay, nothing excites them anymore. Their favorite dishes also, they'll say, I just don't feel like doing it anymore. Absolutely, they've given up. And there is lassitude after eating. So usually they need a good 2-3 hours nap after they have gone through this process. Modalities, emotions, they no longer have a threshold to handle any kind of stress. So any kind of exciting information, any kind of anxiety, anything that happens, they just find themselves to be extremely harrowed. They're not able to tackle it anymore. So they will start telling their family members that you please just stop talking to me. I'm not interested in this. Please go away. Okay, don't tell me about this. You go and tell someone else. Okay. They are aggravated by cold, music, talking, masturbation, anything that causes some sort of depletion in their system. They are better by warmth, short sleep, and better by mild motion or pressure. Okay. And the last remedy is lachesis. Yeah. So lachesis I've covered in both this and suppressed. I will cover them together right now. Okay. Lachesis, like phosphorus, is again a very, very romantic remedy. Okay. They have a lot of ideals. They have a very clear-cut picture of how life should be led. Okay. Now the difference between phosphorus and lachesis is that lachesis is also very self-sufficient. They will hold their end of the bargain very well. Second is it's an animal remedy. So there is an excess of energy. They are animated. They have energy at the level of the mind. So they are very creative. They are very intellectually strong, and they're very, very self-possessed. They know they can tackle things very easily. But the disappointment starts occurring when the person in front is not able to live up to their expectations of how life should be. Okay. So unlike phosphorus, which has given away its power and said that there's nothing I can do, the other person doesn't want to listen, lachesis becomes very aggressive. It wants to manipulate and change the circumstance to suit it. It's almost like saying, how dare you do what you want to do? Don't you understand that I have done everything so far to set my life so well? You better accommodate for me. Okay. So usually lachesis goes from that perspective. So although there is a lot of disappointment, lachesis tends to be very action oriented, and they want to change the circumstance. So that is why they do have a lot of anticipation. They do have a lot of anxiety, but it is always from, the way they talk is, you better make them do something. You better make sure that the situation occurs. Okay. Now this can make them very aggressive. Okay. They tend to be very quarrelsome. They are very critical of the situation, especially whoever the person is. So typically, if they come together as a couple, or they come together as a parent and child in the clinic, they don't feel ashamed of criticizing whoever the family member with them, right? They will talk bad about them to their face, almost to the extent that, oh, see, you deserve it. You deserve that I complain to the doctor about you. Okay, you better understand how bad you are. Okay, so they tend to be very quarrelsome. There's a lot of mocking, and there's a lot of jealousy. Okay, so when they are struggling and they see their spouse or they see their child or family member enjoying themselves, they just cannot take it. Okay, so they tend to be very aggressive. So that is why many times the anxiety of a lachesis may not be very visible. It is the aggression that is shown out. So people, attendants of lachesis are not going to come back and tell you that, oh yeah, they're really harrowed by situations or they're always anxious and thinking. No, they usually come and say this person is a terror. They're always yelling at me, they're always scolding me. It's very difficult. Even if I breathe wrong, they will criticize me. So it is something that their aggression is always something that comes up in the forefront. But the internal situation that is occurring is a constant state of anxiety. They're constantly trying to see whether the situation can be manipulated into adapting to what version that they are looking out for. Okay. Physical is they have extremely high energy, all right, and this energy is seen in their loquacity also. They can talk volumes. It's not just skipping of the topic, it is the amount they talk also. Each topic is given a good quadrant and they can speak for lengthy periods of time. Okay, and the loquacity of a lachesis becomes worse with their anxiety. The more anxious the patient is, the more loquacious they are. Okay, many times to the extent that they actually have difficulty breathing. They tend to gasp while they talk like that because they are speaking so much, because they have so much to vent out. All right, very high energy. Okay, especially towards the evening and night. Extremely long, heightened sexual drive. Now, similar to Pulsatilla, when I told you that she is a creature of senses. She wants her senses to be pacified. She wants to be consoled. So Pulsatilla is still a very mellow, low intensity version. Lachesis is a very high intensity version. Now you will see that sexuality starts coming up very strongly in features of anxiety because it releases a lot of oxytocin. It releases a lot of happy hormones. So people feel safe and they feel better. Okay, so you will see that coming up as a symptom when people are very frustrated and anxious. Okay, and they're very heightened sensitivity. They are almost to the extent of paranoia. Lachesis has all the antenna up, searching for situations to occur. Now, in all of this, you will think that this person seems to be very happy. They seem to be very vivacious. Why have you put it in depressive anxiety? Now, the thing is, lachesis is such a strong remedy. They are so proud of themselves that they will not show that they will start to deteriorate. Okay, but it is a remedy that can fall into syphilis very quickly, and they will very quickly go into a phase of becoming apathetic. They will start to become discontented. They will become asocial. Okay, they will cut themselves off very quickly. So it is a psychosyphilitic remedy. So they will shift from being psychotic to syphilitic very quickly. So in lachesis, you have to be careful. You have to be vigilant that although they are presenting with agitation, they are presenting with aggression, they might actually go into depression very, very fast. And the way this usually displays is by their physical symptoms. Okay, they tend to become more sleepy, they tend to become more isolated. Okay, they will not eat as much as they normally do. At that time, if you sit them down and ask them what is happening, they will say, Doctor, I'm fed up now. I just don't feel like living anymore. I just don't feel like doing anything anymore. I want to stop eating. What is the point of it? Then that is where that depressive feature starts to display itself. Okay, so lachesis is a remedy you have to be very careful about, because externally they look like very strong, very reassured individuals. Okay, and they usually don't like showing their sensitive side. It is a remedy that is terrible after sleep because they have no control over their mind, and it's a very powerful mind, so it goes out of control. So they are usually aggravated after sleep. They are aggravated in the heat and by any kind of suppressed discharges. So it is one of the remedies that really struggles in the premenstrual period and is better by the menstrual flow. Okay, they are better by open air, free secretions, and by cold drinks and hard pressure. Now, one thing is they also have a lot of sensitivity towards drafts, but they need circulation at the same time. Okay, so this contradictory symptoms of lachesis is something that you do need to pay attention to, where they want something like a fan on but far away. They cannot take a draft that is immediately on the head or immediately on the skin. Okay, and the last therapeutic section is of remedies that are suppressed. Okay, yeah, Twinda, what is the first one?
Magmure.
Magnesium mure is a magnesium group in general is a very interesting set of remedies, right? You have to understand feeling forsaken is a very broad spectrum term. Okay, in magnesium, there is abandonment. Okay, you have to understand it is not just that I'm not being paid attention to, I'm not given importance. It is pure abandonment. The patient feels like he or she has no support system. Okay, now this leads to a dual feeling. It leads to extreme rage because they feel that they should be given support, they should be taken care of. So that extreme vehement rage comes up. And the second thing is extreme paranoia. Okay, because now they really genuinely feel abandoned, that they don't know how to handle situations, they don't know how to go about life, and they find themselves with zero resources. Okay, so understanding that concept of magnesium is very important. It isn't as simple as, oh, my spouse is not talking to me, oh, I have a difficult relationship with my mom. It's not like that. It is feeling abandoned, no help, no resources, no thought process of how to go forward. Okay, so that is why it is one of the most deep acting remedies that you will get. Now, Magmure has a duality about it. On one side, the paranoia comes up, right? So when a person feels like they have no resources, they will stick to whatever and whoever is available. So they are not going to be picky. You know, they say beggars can't be choosers, right? So they are not going to be picky about the people they hang out with. So they will dislike any kind of confrontation that is there. And that is why you see them succumbing to the worst circumstances. They tend to remain in abusive relationships. They tend to remain in really manipulative situations because they're so frightened about being left out without any help, right? So absolutely dislike for confrontation. There is a strong sense of responsibility. Now, what starts to happen is that they feel if they put in enough work, they put in enough efforts, they can fix the situation. So anything that happens, okay, typically you will see this in an empath, person who's empathetic and a narcissist. Usually you see that this kind of dynamic occurring, that the narcissist will blame every situation on the person and they will feel responsible. That, oh, it is because of me that they got angry. I should be more disciplined. I should be better behaved. Okay, so there is a lot of suppression, lot of control. Everything has been pressed down. And usually when you meet these kind of patients in your clinic also, you will see that level of extreme control, right? They're just so tight inside. And one of the biggest symptoms of Magmure is the constipation, right? The tightening, the holding back, that kind of fear of losing the slightest bit of control because everything else will unravel. Okay, that's a very, very big symptom. And this is not something that can really be spoken about. It has to be observed and seen, right? There is a basic central emotional imbalance and unsteadiness. They feel they're helpless, right? Like I told you right in the beginning, that they are given the power away to somebody else completely. So there is a lot of despondency, a lot of despair, and they're constantly worried about losing that one source of stability that they have. Now, the contradiction in this is that when they are pushed beyond the edge, magnesium can be one of the most violent remedies that are there. Okay, they can be extremely abusive, they can be very, very physically violent, they can go into fury and rage. But again, you have to understand it is like an animal that is caged. Okay, they have absolutely no other way but to fight. Or you must have heard of a lot of cases of people who have been in abusive relationships for a long time. Finally, they snap and they beat up their partner, okay, because they can't take it anymore. So that is the kind of violence you're going to look at from magnesium, okay? There is aggravation in the night. There is a lot of abdominal symptoms that you will get with magnesium, all right? You will get a lot of cases where you will have bloating, you will have extreme constipation with a lot of dry, hard stools. Okay, the patient is chilly, they have a craving for open air. This is a duality that you will see, that they are unloved, they feel very cold, they feel very abandoned, but at the same time, they feel suffocated because of the very toxic dynamic that they are a part of. So they need open air and circulation also. There is significant aggravation from milk. This is usually a good feature. So the remedy that comes very close to magnesium is laccan or the lac group, right? Both of them feel very abandoned and they both feel very forsaken. And again, in lac group, you will see that there is milk aggravation that is there. Okay, so that is one differentiation you need to be careful of. The way laccan specifically behaves is by being very appeasing to the person, right? They try to get into their good books, they try to be very sweet, they try to be very loving. Okay, but whereas magnesium will be controlled, they will just be introverted and they will try to go into themselves. Pinta, can you help me with the second remedy, please?
Yes, ma'am. Natrum sulph.
This is another remedy that is very, very, so natrum sulph again is a very interesting duality that is there. It is one of the most stoic, most sensible, most externally relaxed or steady remedies that you will get. Okay, usually people with natrum self will come and tell you that, oh, this is what it is. This is my life. This is my karma. This is what I have been given. I have to deal with it. So they look extremely practical and sorted externally, but internally that turmoil is boiling. Now, natrum self, unfortunately, is very difficult to crack. Okay, they are the most introverted of the natrum group that you will see. Natrum youth still tends to be aggressive. They still tend to express themselves. But this is very, very difficult to crack natrum self. And usually it is the physical symptoms that help you out. If you by chance do get a natrum self to open up and speak to you, you will see that emotional suppression is a very strong feature, and they will also tend to not address the emotions. Okay, there is a difference between a person being resolved in their head saying that, okay, this is the situation I have to live by, and a natrum self who will just avoid the situation altogether. Okay, so they will speak about it as though they are living from a third person's perspective. They will not speak like they've been involved in their lives. So emotions that are not they feel emotions not involved in life, not impulsive, not spontaneous at all, very, very boring, very bland people, and they're almost robotic. Okay, like I had told you, in acid force they tend to become mask like. Natrum self is also like that, but also unlike in acid force where there is draining and there is prostration, this is not seen in natrum self. Okay, mental changes arising from injuries to the head. Now, this is an interesting feature. A lot of your natrum self patients will have a history of being injured in the head, either sadly because of the abusive relationship where they have actually been hit, or either they've fallen and they've hurt themselves. I don't know how it precipitates in that manner, but almost all the cases I have seen, they have had this history. Okay, there is sadness and suicidal disposition. Now, unfortunately, a lot of the times you may not have access to this. Okay, but if you do manage to give them a lot of space, you do tend to build a rapport. They will speak about the fact that they've just lost interest in life. It is not the frustrated thought process that many people have, right? Like when you are stuck in a situation and you see, I should just die, I just want to get out of the situation. It's not like that. They have completely become apathetic and they have no interest left. Okay, and that sadness and that lack of liveliness is very apparent in a natrum self. That is a very strong indicator. Okay, there is irritability in the morning. So natrum self is typically a very bad morning person. Okay, and when you say irritability, it's not the irritability you and I go through that I just don't want to get up, I want to lie down for 5 minutes more. It is genuine. They're bad to be around in the mornings. And there is mania alternating with depression. Now, this is in the extreme cases where they become very violent and they become rageful. Okay, this is towards the end of when they become syphilitic fully. This is not very common because natrum self is known to be a steady remedy that way. Okay, very warm-blooded patients, and very typically the features that will help you out is the aggravation from thunderstorms, aggravation from rainy monsoon weather. Okay, or any kind of humid environment. Okay, they're very typically a hydrogenoid constitution. So anything that is watery and anything that has like eating cucumbers, eating watermelons, all of these are indicators for natrum self. Okay, so even if you do not get a lot of detail as far as their life is concerned because they are that close and they're introverted, your physical symptoms will help you choose the remedy. Okay, Twinda, can you tell me the third remedy, please?
Yeah, lachesis.
So lachesis has come up again. Again, I told you that they do tend to be extremely, they do have a lot of suppression, right? But one thing you will see about lachesis is they tend to be very humorous in the way they speak. Okay, you will see a lot of the way they narrate their symptoms, the way they speak about their symptoms. They will have a lot of jesting. They will have a lot of mocking. Okay, they tend to be very gregarious. But slowly, this starts to become dull. Now, lachesis can go into a phase of absolute apathy, just like your natrum self, but you will have the feature of that transitioning happening. So if you ask the attendant of the patient or a family member of the patient, they will tell you that earlier on they used to be terrible. Okay, but now they've become quieter. But any interaction that is there, they're only aggressive. They're only biting back. Like a snake that tends to bite you, they only tend to be very censorious and they tend to be very, very abusive, right? They hurt. What they talk about hurts. They're very hurtful people. But when the leukemia patient is talking to you, they tend to be they have a certain sense of bravado, and they really have a bit of dark humor also. Okay, so usually the interactions that contrast is seen, that in front of you, you see a person who seems to be lively, seems to have a lot of humor in them, whereas a family member will come and say that they're horrible. It's very difficult to handle them. Okay, of course, the physical symptoms that I spoke about earlier on will also be included here. And then the last remedy,
carcinosin.
Sorry,
Car-
carcinosin.
Yeah.
So carcinosin again is one of those remedies that are very sensitive. Okay, almost to the level of phosphorus sensitivity. They are very, very subtle, refined people. Okay, now these sensitive people are, again, like palladium, very dependent on their validation from outside. All right, they are especially born to parents who are extremely anxious, right? The parents who will teach the child right from the start about diseases, about infections, about how to take care of themselves, right? Where it will make the child extremely worried and troubled, and will also have a checklist of things that need to be done. So very rule abiding, or they are extremely strict parents, right? Irrational, erratic people who do not have any kind of regulation of their emotions, who tend to explode. Okay, such kind of parents usually give rise to a carcinosin child who is completely absorbed of their spontaneity. Okay, so a carcinosin externally is an excellent person. So if you marry a carcinosin, or you have a friend of a you are a friend of a carcinosin, it's excellent, because they are such well-regulated, refined people. They will come to know your moods. They will come to know about your behavioral changes. They will come to know about your schedules, everything. Very, very conscientious, right? They'll be very careful to speak to you in a politically correct manner so that you don't get troubled. Okay, so externally you look at them and think, my goodness, what an amazing individual. We had a carcinosin patient who did not want to trouble her family at all, right? She did not want to make them struggle at all. So she drove down to the neighboring city of Pune, spent a week. She told her family members she was going for some work. She drove herself down, got herself a hysterectomy, right? She went through that operation alone, and once she recovered, she drove back down a week later, and she didn't tell anybody. People came to know years later that she had got a hysterectomy done. And that is the level of adjustment or adaptation a carcinosin is capable of. Okay, and very proper. They're very polite, they're very proper, almost aristocratic in a particular way. But you can imagine the internal environment of a person like this is going to be so tense, right? They're going to be so controlled and contained, and they're going to be so they're going to think all the time about how they have to tackle situations. Okay, so people who have undergone grief, have undergone any kind of emotional suppression, where their spontaneity is lost and they become almost robotic. Okay, there's a lot of anticipatory anxiety, and you have ailments from anticipation. Okay, so you will see that these people also, along with their refinement, they also tend to be very sensitive. So you will have them having sensitivity to music, you will have sensitivity to people around them. This will showcase itself in a very different manner. Okay, this is not something that is very obvious, but they will say that, I don't like listening to death metal. I don't like listening to this popular rock music. I like peaceful classical music. I like instrumental music, something that's relaxed and gentle. Okay, I don't like going to crowded areas. I like to go to the mountains and relax comfortably on my own. So anything that allows them to relax and not be their constant robotic self, right? They are like an algorithm. It is just A plus A, 1 plus 1 is equal to 2. So they need to relax from that stress. They need to relax from that constant vigilance that is present, right? So you will see that amelioration is also along those areas. So going to the seashore, being around the waves, feeling that relaxation, being in the open air, all of these things that allow them to calm down, relax, and disengage from their performance that is always present. Okay, carcinosin tends to be a hot patient, right? They tend to be sensitive to heat, but you might find that they are also chilly. So there is no proper thermal variant in carcinosin per se. You will see that there is an aggravation. Sorry, this is wrong. There's an amelioration from thunderstorm. Okay, this is a very interesting feature and is one of the features that will differentiate carcinosin from phosphorus. where phosphorus is so sensitive that they cannot take that electrical disparity that is present, whereas carcinosin enjoys that thunderstorm being released, like that release of energy is something that they really feel good about. Okay. All right, and one bonus is backflower remedy called rescue remedy. This is something that really helps you out in practice. Okay, now this is a combination remedy of rock rose, impatiens, clematis, star of Bethlehem, and cherry plum. This is not a deep acting remedy at all. Okay, and this can be given to a wide variety of patients. I have seen this acting so beautifully in my practice to allow two things. One is if the patient is in a very heightened state of anxiety, it calms them down. Okay, to the extent that they can at least utilize their brains to give you a proper case. They can calm down enough to speak about their case correctly. And the second thing is that it allows them to adapt. It's not that the anxiety goes away. It is not that the stress factor has gone away, but at least they don't lose their senses while they are taking rescue remedy. Okay, so this is not per se an acute, this is not per se a constitutional, it's almost like a supplement that you can give. And it acts beautifully. It doesn't act for a very long time. Okay, so you will not see that one dose will sustain the action for a long period of time. It can be given while you are tackling cases of extreme stress. It is not isolated to anxiety. You can give it to any kind of stress that a patient suffers from. It really helps regulate the system. It helps them, their physiological processes to come down back to normal. And it will allow the patient to become aware. They are able to see that, yes, I am becoming anxious and I'm able to stop myself from reacting the way I used to react. Okay, so rescue remedy in general is something I very highly recommend in practice. It's a very beautifully acting remedy and it will help me in a lot of the cases. Okay, I think we've spoken about handling an acute episode. First is ask them to be aware of the triggering factors. Tell them that, see, one is avoid it. Second is when you know you're going to go towards something that triggers you, be mentally prepared. Okay, calm yourself down, calm your nerves down, and then you address the situation. Second is have your medicines handy at all the time. And like I told you before, you need to educate the patients on how to take the medicine depending on the intensity and frequency of their episodes. And advising dietary measures. Now, this is not something you usually consider when you speak about anxiety, but you have to understand any kind of physiological variant in a person struggling with anxiety is something that will play a factor. Okay, so the first thing you want to tell them is that don't stress eat. Okay, don't go for sugar, don't go for caffeine, don't go for alcohol. Try and eat something beforehand itself. Try and pack yourself with protein and fats and good amount of fiber so that your body is relaxed when you are mentally distressed. If you are not going to take care of your body also and your mind is going to be struggling, it just cascades into a worse situation. Okay. Now we're going to see a couple of very short, very simple cases. Okay, this is more to illustrate the way a person, actually going through the process, because we have spoken about it in detail. The remedies are very simple, so I'm sure you'll be able to guess it very easily. Okay, in the process of case taking, you first want to see the evolution of the patient as a person. So especially childhood, right? That really defines how a person is going to conduct themselves in life. So make sure that you talk about childhood with a lot of take that one sector very properly, because one is patients are usually not that embarrassed to speak about their childhood. Okay, people don't feel ashamed of saying that I used to cry a lot, I used to be, as opposed to saying it right now. So I wouldn't feel bad about saying that I cried as a 5-year-old, but I would feel very bad about saying that I cried as a 35-year-old. Okay, so childhood is usually an easier place to speak about. And the second thing is that is where all the habit formations also occur. So speaking about the patient in childhood, the family situation, the financial situation in the childhood, and the schooling situation can give you a very good idea of where the person has come from. Okay. The reactions of the patient, as we've spoken about, and physical generals or the physical symptoms will help you delineate the remedies further. Okay. So the first case was of a 75-year-old woman. Okay, she came to us and she had a complaint of hoarseness in the throat. Okay, and the thing was that the husband had passed away about a year and a half back. He had developed an illness and he fell sick and he passed away. Now, the interesting thing is everybody assumed that it was grief and depression that she was going through, that the loss of her husband had put her into a grief, in a very sad state. Now, this hoarseness of the voice had started very suddenly, and it had remained. She had constantly continued with that raspy voice all of a sudden, and it stayed the same. It did not become worse, it did not reduce, nothing of the sort. Okay. She had been to several ear, nose, throat doctors. They had done a scopy also. They had seen if there's any vocal nodule, there is any structural issue. There was nothing. Patient was physically perfectly fine. All her investigations were on point. There was absolutely nothing that was there. As such, there were no modalities of time or circumstance. The patient tended to remain the same through and through. And she had no other symptom of cough, irritation, acid reflux, postnasal drip, sinusitis, nothing of the sort. Okay. Now the patient was, I'm sorry, 67. I said 75, 67-year-old female, and she was living with her sons and daughters-in-law. She hailed from an orthodox, traditional Hindu family, where typically the in-laws come first, like the parents are treated with a lot of respect, and then the next generation is there. Now you have to understand, like in that kind of social strata, usually the mother-in-law is somebody with a lot of authority, right? She's somebody who's taken very seriously. She's almost to the extent that the daughters-in-law should be scared of her, right? She's a very domineering figure. So the patient, the family said that since the father-in-law has passed away, she's become very needy. She's become very cranky. She wants people around her all the time. She exaggerates almost all the symptoms that are there. She becomes very bad-tempered, right? And she gets offended very easily. So what starts to happen is that she started to become more clingy. She wants people around. And any small symptom that occurs, she tends to exaggerate a lot. She immediately wants to be taken to the doctor. She immediately wants attention. She'll go on asking the, patient, the family. Oh, sorry. Yes, we'll finish off quickly. So we'll do only one case then. Okay. So immediately what happened is that she started to feel extremely, she wanted constant attention, that something was going to happen and be taken to the doctor. Okay. So what happened is in this process is that we saw that the patient felt like her authority was taken away. So usually in Hinduism, what happens is that the female is treated well as long as she has a husband. The moment she becomes a widow, she becomes an outcast. Okay. And that is what happened. It wasn't that she was grieving because she lost her partner, but she felt that her authority had gone away. She was humiliated and she felt that her respect was lost, that no one is going to give me any importance anymore and people are going to be extremely, derogatory towards me. So she quite literally felt like she had lost her voice, that the impact of her words were no longer seen in the situation. All right. So in this particular case, we see that ailments from position loss is the first thing that happened. It was not, in fact, grief. It was not depression. It was not anxiety of how she's going to be taken care of, but the fact that her honor had been taken away. Okay. The second is hoarseness of voice, honor wounded, and emotion suppressed. She had to keep quiet now. She's saying, now no one is going to listen to me. I have to keep quiet. I can't boss my daughters-in-law around anymore. I can't tell them. She didn't say it like that, but she couldn't do that anymore, right? And the first remedy that came up was staphysagria. Okay, so when you look at the remedies that you see of being indignated, humiliated, or when you see their honor being wounded, you will see these 4 remedies coming up. Okay, so staphysagria is one remedy that somatizes very quickly. They suppress themselves. They feel that their dignity is lost. Okay, they feel like people are constantly looking around them and humiliating them. So usually staphysagria pushes everything down till there is an exciting factor. The moment there is an exciting factor, like a symptom coming up, a person ignoring them being humiliated, they tend to become very expressive. Okay. In her case, she was obviously still not that dysregulated. So she did not have episodes of violence. But usually, sometimes in staphysagria, it can go up to the point where the people can become aggressive, physically violent, or they can also become addictive. Okay. Staphysagria will try to drown their emotions in alcohol or smoking, or even sometimes they become workaholics just to get away from that emotional disparity. The second remedy is ignatia. All of us know about this. Ignatia, especially in cases like this, will have 2 representations. Either it will become hysterical, right? Out of proportion response, right? They will howl loudly, they will bawl loudly, or they become extremely angry. Usually they are very dignified and settled, but suddenly they will have an explosive response. Or the second is they'll completely shut off, right? Silent grief. And along with that silent grief, a feature that comes up very strongly is insomnia. They will stop sleeping. They become, very, what do you say, grumpy, and they will sulk a lot. Okay, they'll become very silent. Okay, so these are the two ways Ignatia can present. Platina is very derogative. Whenever they are humiliated, what happens is that they start to offend the other person. They do have a lot of anxiety, they panic a lot, they become very flustered. But the way they respond is by insulting the other person, being derogatory to the extent that they can have desire to kill the other person. That is why you see homicidal tendencies in Platina, right? They want to get rid of the factor of that situation that is causing the humiliation or the insult. Okay, and lycopodium is a dual feature. Okay, he or she can either try to really placate the person, like they'll try to butter them up, if especially if they feel that the person is above them, authority figure, they'll try to butter them up and be very, very manipulative, or they will try to become very dismissive of the person beneath them. Okay, one of the features of lycopodium is they can be extremely petty. They are very, very petulant. They can be very silly. They will argue like a small child. Okay, so if you tell them, for example, if you tell them that, okay, you're being irrational, they'll say, oh, your face is irrational. It's just a very silly, very childish thing that comes out of it. So lycopodium is known to be they're bad sports. Okay. So we gave this patient staphysagria. It was a very interesting case. So it really showed what is happening at the level of the mind precipitated in the body. Right? Staphysagria 1M, 3 powders was given. She came back to us 2 weeks later and 80% her voice had improved. She did not come back, but when we called her, especially for the sake of the presentation, we called her to find out how she was. She's completely normal and she's feeling much better. Also, socially, she has started to regain her function. She's becoming more calm. She's getting involved in house activities and household work. And generally, she's starting to regulate herself. Okay, I think we've really run out of time. I'm so sorry. I got lost in the presentation. I didn't realize. Shall we stop here?
Do we have any questions? If we have, then we can just address them quickly.
Hello, doctor. Good evening.
Good evening.
I need to have a very little time. 3 things I have to talk with your permission. Is it okay?
Yes, please.
First thing, I have to appreciate really the whole program, explanation about your anxiety and fear, and so detailed, accurately told each remedy. Fantastic, I should say. Really fantastic. Thank you very much.
Thank you.
3 questions. The last will be a little bit longer, but I will try to make the shorter one. Lachesis we have talked is really nicely told at you. With your experience, how the repetition of this lachesis, how prudenza means how careful we have to be for the repetitions. If suppose with a difficult case, we have given a mental case, example, 10,000 directly is needed, how long really we must wait?
Okay.
Because
so,
as for snake, it's not easy to repeat what I think so,
It's not. That's correct.
And yeah, first thing. Please accept my appreciation, certainly, for everything. Thank you very much.
Thank you so much. See, lachesis, first thing is you have to see whether it is only the mental picture you are addressing, right? If it's an outward case of anxiety, lachesis is an excellent remedy for psychiatry. You see a lot of cases of schizophrenia being treated by lachesis. So if it is purely a mental picture where the person is anxious, then going towards a higher potency is good, right?
Yeah.
You can start with 1M and go to 10M. You can repeat on a daily basis, but you do have to titrate it. So I would suggest that you start with 1 powder or 1 dose and see how the patient is going, right? And you would repeat the medicine when the person either hits a stagnation or when the patient starts to regain their symptoms, right? It starts to relapse. One thing I will say about lachesis is the nighttime aggravation is very real. So please avoid giving lachesis as much as is possible in the night. Try to give it as the first dose in the morning, right?
Morning.
Give it in the morning,
Okay.
yeah.
Yeah.
When the patient has some other issue like diabetes or an unhealing wound or some kind of physical like very bad asthma, right? Like SS is given for
Yeah.
asthma. So in those cases, you want to give a lower potency like 30 or 200. Okay, and in those cases, you can repeat the remedy multiple times. So 30 3 times a day or 30 twice a day is fine. But again, as much as is possible, the last dose should be given within 7 o'clock in the evening. Don't give it at night time. If it is best to avoid it. And the third thing is, if the patient is sensitive, which like SS patients are very often,
Yeah.
you can dilute the dose. You can dilute in water or give third dilution. Okay.
Oh, okay.
Something
Okay.
that works beautifully, especially in children or very, very heightened patients. Third dilution really helps. So there will be no side effect, but the medicine acts very beautifully. So
Okay.
yeah, these are the three things you can look out for when you are, and you don't have to be that scared. I will say that like I have not seen aggravation to the way we have heard of that Dr. Herring, he's got that throat aggravation. I have not
Yes.
seen those kind of aggravations occur in practice up to this point. Maximum that the person will have a very unfortunate night. They won't be able to sleep throughout the night the day they take the night dose. You don't have to be very scared, but in structural cases, yes. So if the person has got a bleeding disorder, the person has a non-healing ulcer, in such cases, you should be careful of not repeating too often. Okay, but
Yeah.
otherwise, you don't have to be that frightened. Like nothing major happens that way. You can just ask
Perfect.
them to have a strong cup of coffee, then you'll be fine.
I'll be appreciating in case that I will tell to the doctor in the office of Dr. Preeti or whatever, that they can give your email to me, that
Sure.
I'll be
appreciating
that maybe I can discuss something about one or two cases.
Sure.
So
Anytime.
last question, that's very important. As we were talking about anxiety and fear, again, I have to say thank you. How clearly you explained about the combination of these things, why it came to me very interesting, because I need to have your comments upon a patient with example to understand more. Your comments, they're very important this moment. The patient's about 40 years, a man, very long time suffering, about maybe 10 years. He came for polyps of the nose and very difficult to respirations, and odor has gone away. He cannot smell anything, but actually his fear is, and anxiety is very important, that he cannot take the lift. He is working on the 5th floor. He must go through the stairs. He cannot go to the cellar down, -1 floor, because if he's totally closed, one door might be there in that room.
Yeah.
It's very difficult. He's looking for the door, He's get so anxious that he have to call to someone. This is very important. He have to call to someone to understand that he's in company, whether someone is there listening his trouble, but he's not having physically with something. That thing, he cannot go to the public very easily. He's not question of afraid, he's telling, but he's avoiding always to go. But the main thing, sudden panic attack. He's going with bike, he will stop it. He have to say, I have to do the respiration, as he says. He stopped and he will have the difficult of respiration. Are you listening, doctor? So these combinations of this fear and anxiety just guide me, because the remedy that we were talking, first one, certainly there was no other way for me to do that remedy that we have spoken. You will understand. But still, I needed to understand, because he's telling what was his experience at that time when we were having difficulty with this thing. He said, it's very negative experience, that negative and negative. I said, what does it mean by negative? I was wanting that he will talk about death maybe, because situation is, if we don't respiration is difficult, that maybe everybody like me itself might be thinking about something may happen to me that I will die. It's myself. But I don't like to do my theories that death word he will speak. I want him to tell that finally he told something. Yes, of course, it may happen, but the negative and the old situation guide me for this. Commence yourself for anxiety and fear of this person. Please do that.
So the first thing is
Sorry for the being lengthy, because it was very important to explain to you the situation. Thank you very much.
no problem. So the first thing you have to notice in this is that the patient is in a state, right? The patient is in a state where he just does not have access to the rest of his senses, right? So a person otherwise might be very regulated, may have common sense, all of that. But at this point, the patient is just not having access to all of those senses, right? So the first thing you need to understand is this is a low susceptibility. Okay, this is not something that is, the person is not receptive to a lot of things. Okay, the second thing is you don't have access to the rest of the patient. You only have this much to look at. Okay, so at this point, don't think too much about his personality, the rest of his issues, his life history, all that you put to the side at this point. You can start giving the patient rescue remedy first, okay, for some time, so that he starts to regulate himself, he starts to adapt. Okay, then go for what is present in the case. So you can also consider stramonium, right? He's very frightened and he's very claustrophobic and he wants company. He's that harrowed by the situation. So stramonium can come up as an acute for him, but at the same time, give rescue remedy for 2-3 days and let it act on him, and then ask him how he's doing. Okay. The third thing I will tell you is, now this is something you will have to understand as you speak with the patient. Such kind of fears and anxieties usually has one incident that has occurred in the childhood or in some early part of life that has triggered this response. Okay, try to ask the patient that since when did you start to feel this, what had happened, and it is not something that he will remember immediately. It is possible that you will ask this question and he will come back 1 week or 2 weeks later and say, oh, I was sitting idly and then I suddenly remembered about this. Okay, but definitely the moment you hit that crux situation that has caused him to feel this fear of extreme fear and extreme threat will come up. It can be something very small. It can be something very insignificant in his childhood that could have triggered, like a mouse coming out of the blues and scaring him. Okay, but if you really want to solve this case, that is something that needs to be addressed. Now, this can either be done by you, or you can refer him to a counselor who can put him through therapy and take him through the processes. Okay, but this is something that needs to be done in the long run. It needn't be addressed immediately. Initial, I would suggest that you give him rescue remedy, re-evaluate the case, see the symptoms that are apparent and available to you. Don't go too much into depth and the workings of the mind. Just look at what's available right now and prescribe for the right now. Then that state, once it has been surpassed and everything else is coming back to normal, then you will have access to him as a person, right? Like the proper case or the original picture. So I would suggest that you take it step by step. There is no need to go right to the core at this point. Alleviate his symptoms first and then try to resolve the conflict.
Fantastic. Thank you very much, really. Thank you for everything. It was really a great pleasure. I was waiting for maybe 2 weeks when they sent me the message that for anxiety, that I was very careful that I must not miss this lecture and beautiful session. For me, thank you and namaskar.
Thank you. Thank you.
Thank you. Thank you, Dr. Vidya.
Thank you so much, ma'am. Our chat box is filling with compliments for you.
Thank you.
I think you were so involved in the presentation.
I completely lost track.
That's okay. I think we can just go on and on listening to you, because it actually took me back to my college days. I really enjoyed. I think the participants also enjoyed. And if we just had a little more time, we could do a lot more cases from your side. Maybe we'll keep that for some other day then. Surely we'll do that.
But I do have a recommendation for all the practitioners. Right? There is a book called Habits of a Happy Brain. Okay, please search for it and read the book. It is excellent. It speaks of physiology, right? It's not all the stuff we speak about the mind is one thing, but it speaks of physiology. It is an essential book for our practice. So please go search for it. It's available on Amazon, order it, and please go through it. It will help you a lot in your practice. Okay. So I wanted to get that in before we finish off. Yeah.
So thank you, ma'am, for the
I'm
lovely
comparing your situations with the very great doctors. As much you explained the materia medica, fantastic, really. Believe me that. Thank you.
Ma'am, the name of the book, can you please repeat it?
Yeah, I'll type it out in the box.
Yeah.
Oh,
And
yes.
for those who need the recording, the session is already on YouTube, so you can go and watch it there. So it's been relayed live. You can later on watch it. Okay. Habits of happy brain. Okay. Thank you so much, ma'am, for coming on Homeopathy Musing. Pleasure to hear you again. And you've given us anxiety in its entirety. Actually, it's not just about the symptoms of materia medica, but you explain why those symptoms are occurring, which is so important, because we know the symptoms in the book, but we don't know how the patient is going to come and tell us and how to decipher that. So thank you, really grateful to you, and see you soon, ma'am, on Homeopathy Musing.
I look forward to it, and hopefully within the time frame that is good. Thank you so much for listening.
No problem. Yeah. Thank you, ma'am. Have a great day.
You too. All of you, thank you for attending. Bye-bye.
Yeah. Bye.
I will
So
request
we'll meet next
Dr. That our presentations to write your email, please. Thank you.
Oh, shall I type my email and I can type it in?
Yeah, would be fantastic.
Yes, there it is. Very unconventional email, but yeah.
Okay. It's free65002@gmail.com. Thank you.
All right.
Thank you, ma'am. Thank you all. So we'll meet next month in our next musing. Bye.